Bwrdd croeso pawb. Good morning and welcome everyone to the July meeting of Digital and Healthcare Wales Board. Hope everyone is well and enjoying the summer. The usual preliminaries, as you can see, as is obvious, the meeting's been held virtually as we continue to do and will certainly be doing, I think, for the foreseeable future. Seems to work very well and allows the public to engage much more easily with the board meeting. The recording of this board meeting, as is usually the case, will be up on our website shortly after the end of the meeting. If anyone who isn't able to observe wishes to catch up on it at a later date. We do have simultaneous translation facilities in place, and I'll just go through how people can access that if they wish to hear the translation. If you hover your mouse over your Zoom screen, you'll see a toolbar come up at the bottom, and the second from the right says Hear Translation. If you click on that, if you wish to hear the translation, select Hear Translation. I think if you don't wish to hear it, it's just leave it as original. And there will be a number of presentations through the medium of Welsh. So please do select Hear Translation if you wish to hear an English translation. As is ever the case, as I am doing now, board members may not always be looking at the screen, for which we apologise. But we either have another screen or some papers in front of us. So please do understand that. We're going to be taking a comfort break for about 15 minutes. And the meeting's scheduled to finish at 1:30. And of course, later this afternoon, we will all be back here again on Zoom for our first annual general meeting, which I know the board are very much looking forward to, in talking about the significant progress we've made and the significant achievements we've made through the first year of digital healthcare in Wales. Again, that will be on Zoom. So please, if you are watching today, please do join us this afternoon. And indeed, there will be an opportunity to ask questions if you haven't already submitted a question in advance during the meeting. If I then move on to the board into the board meeting, apologies for sorry, just before I go on, we've got a colleague joining us for the listening and learning session from within DHCW, and a colleague from Public Health Wales, who I'm sure Rydian will be introducing when we come to that item on the agenda. So you're both very welcome to today's board meeting. Apologies for absence. I've received no apologies for absence. Are there any that I've missed? I don't think so. Thank you. Declarations of interest. Do excuse me, I'm getting a little bit of feedback at the moment. Hopefully it won't distract me. Declarations of interest. I haven't received any conflicts of interest. Are there any that people would have come across as they've gone through the board papers? No, thank you very much. If I move into the consent agenda, I don't think anything has been raised in advance to move into the main body of the meeting. Is there anything that people would wish to move in? If so, Chris will try and find a place on the agenda. No, thank you. Okay, if I move through the items that we're seeking approval on, or noting, or to be noted. First, could I seek your approval for the minutes from the board meeting held on the 26th of May? Thank you very much. And then approving the private abridged meetings from the board meeting held on the 26th of May also. Thank you very much. And approving the minutes from the extraordinary board meeting, if you recall, that we held for our accounts on the 14th of June. Thank you very much. And then on the next item, I'm just going to ask Sarah Jane, who I believe is joining us, I think. Yes, indeed, for your first board meeting. Sarah Jane is the Director of People and OD. So welcome, Jane. And there you are. We're getting you singing for your supper very early on in your board career. Sarah, you wanted to bring us an update us on the action log, didn't you? And you are on mute at the moment. There we go. You're off mute now.
Good morning. Yes. Sorry, it's actually my second board meeting. I did come.
Oh,
virtual.
I do apologise.
No, it's my first one in the office, but through virtual. In terms of the cost of living, yes, absolutely. It's really close to our hearts, actually. So we've put some time and effort aside as part of our health and wellbeing group to put a task group together, a task and finish group, which has been made up of representatives from workforce, the OD team, the organisational development team, business managers and representatives of the staff, as well as the trade union representatives. We've already put together a financial support page, cost of living page for the workforce, which is offering support and advice to people on various aspects under the cost of living challenges. There's a number of different additional themes that are being taken forward and that are currently in development, including live share and other wellbeing features as well, mainly to offer support and signpost. And one further thing that we're doing is we're looking at what's happening across NHS Wales, and really, rather than start from a blank piece of paper, is to look at where there's good practice and some really good themes happening, is to look at replicating them here if we can as well. So there's a whole range of support features in place. Anyone can contact me or my team outside of looking at that digitally to get us some extra support and some guidance with our employee assistance programme and indeed our occupational health team as well. So we've got a range of things in place, but again, we're open to different ideas, new ideas. And for anyone that's got any particular issues, then please do come and talk to me or my team in confidence, and we'll try to support and signpost people to get that advice and support where needed.
Thank you very much, Sarah Jane. Anyone got any questions or comments on that? No, thank you. So we're happy to note the action log subjects to Sarah Jane's update. Thank you, Sarah Jane. And then pleased to note the forward work plan. And we then need to approve the Welsh Government decarbonisation return, which is in your papers, obviously. People happy to do that? Yes. And then to approve the standing financial instruction report, item 2.7, people happy to do that. Thank you very much. So if you move into the main agenda of the meeting, and then for the shared listening and learning presentation, and I'm going to ask and invite Rydian, the Executive Medical Director, to introduce the item and the guests who are joining us for this item. Rydian.
Good morning all. Thank you very much, Chair. I'm delighted that Sharon Hillier, Director of Screening Services, is joining us today for this item. And Stephen Price from Digital Healthcare Wales will take us through the presentation. A couple of things I just would like to note so that our listeners are aware of the purpose of screening. Screening is essentially testing asymptomatic people, so people without symptoms, for things that could have a significant impact on their life. My personal link with both of these things is very strong. My father died at the age of 58 of a dissecting abdominal aortic aneurysm. And what is that? Well, that's a swelling of the main vessel that comes from the heart down into the tummy that all the major organs have branches from, and a swelling of that. It's normally about 2 centimeters, and you can pick up swelling on ultrasound. Deaths in the community, about 1 in 10 people actually survive this when it ruptures unexpectedly in the community. But elective repair of this has a fantastic curative rate, and that can be done both by open surgery and by our radiology colleagues who are able to put grafts in via the vessel. So it's a very important screening test. The other one is bowel screening, and that's pretty topical at the moment with the recent passing of Dame Deborah James. We don't like to talk about poo and blood in poo, but it's important that we have that conversation. And Public Health Wales are a key partner in us identifying that. Again, early diagnosis has a better chance of cure. So I'd like now to introduce Stephen to present the screen. Good morning, Stephen. The floor is yours.
Morning. Bwrdd, good morning. I'm Stephen Price. I'm an application manager at Digital Health and Care Wales. I've been managing the development, support and hosting of adult screening services for over 15 years. Today's presentation will focus on 2 adult screening services, bowel and abdominal aortic aneurysm Could you go to the next slide, please? I will describe the 2 screening programs and then provide more details, including usage, metrics, cohort selection, key functions, and interfaces with other products. I will then look at the challenges faced when my team developed the software solution and what lessons we learned along this journey and afterwards. Next slide, please. The aim of the AAA screening program is to reduce the number of ruptured aortas and associated deaths. Men who are 65 years of age and live in Wales are invited to take part by visiting a community clinic. The test involves a simple and painless ultrasound scan to measure the abdominal aorta. Did you know men are 6 times more likely to have a AAA than women, and this becomes increasingly common with age? Bowel screening aims to identify cancer at an early stage when treatment is more effective. Men and women aged between 58 and 74 and who live in Wales are invited to take the test every 2 years. The test kit is designed to detect the level of blood in your feces and can be completed at home. Next slide, please. The team started development of bowel screening in 2006, and it was launched in the autumn of 2008. Initially, the participants invited were men and women between the age of 60 and 74. It has now been extended to those between the age of 58 to 74. Other groups, such as prisoners, can also be manually invited into the program. The product provides administrators and laboratory staff with access to common functionalities such as invitations, letter management, laboratory test results, and notifications to GP practices. One of the unique features of this product is that it extends into the secondary care so that specialist screening practitioners in the health boards can manage patient pathways such as colonoscopies. The product is hosted in Public Health Wales' own data centre with integration to national services for patient demographics and to send GP messages. To date, over 1 million participants have been invited onto the programme. On average, 6,000 new participants are invited each week and 3,000 participants are recalled. Next slide, please. The team started developing AAA in 2011, and the software was launched in the spring of 2013. This was the first screening program focused at just men. Participants invited are men approaching their 65th birthday. It also allows clinic walk-ins to be screened. The product provides Public Health Wales administrators and screeners with functionality such as invitations, letter management, clinic scheduling, and a standalone mobile daybook that records the scan. The product again is hosted in Public Health Wales' own data centre with integration to national services for patient demographics and scanned images. To date, over 200,000 participants have been invited onto this program. On average, nearly 2,000 new participants are invited into the program each month. Next slide, please. As with all major projects, delivering to schedule and to requirements is always a challenge. This was true, especially as there was no existing product for comparison and the inability to undertake any parallel running to confirm the new product was behaving as expected. This was a greenfield development and a great opportunity to deliver a world-class product. The team were enthused at developing a product that would help to save lives. One key challenge for AAA was the need to schedule remote clinics. These could take place at any location where the availability of good or any network access was an unknown. As a consequence, the team had to build a standalone application that could then synchronize the results back to the main system. For bowel screening, the FOB card-based test kit was replaced with Liquid Fit. This was to drive efficiency, improvements in the testing process. As a consequence, a significant element of the product was changed. We had to create a new laboratory module and interface directly with new analyzers. When COVID hit, Public Health Wales asked that we pause these programs. This was an event we had never contemplated. We paused the programs at the end of March 2020 and restarted them in July 2020. The restarting of the program was an even greater challenge as we couldn't just switch it back on. We needed to ensure that the 4 months backlog did not arrive en masse and overwhelm the service. Therefore, we needed to add extra functionality to ensure the backlog was managed in a phased approach. Next slide, please. So what did we learn? Never underestimate the involvement required from the customer, especially in terms of testing. Some processes, such as the cohort identification, were not possible to simulate in a non-production environment due to the sheer volume. However, the software was configured with scalability, login, and robust error handling so that any issues could be quickly identified and resolved. Sometimes less is better. For example, excessive participant status codes made the software complex and it can lead to user confusion. We learned this from Bowel and reduced the amount of codes within AAA. This removes granularity, provides easier management, and requires less complex software changes. We also adopted a proactive incident and problem management approach. If we identified a trend or repeat occurrences in support calls, we implemented service improvement plans. We developed functionality that either fixed the issue or provided functions for Public Health Wales to self-manage the issues. For example, a husband and wife swapping test kits or participants submitting test kits from previous mail shots. In terms of hosting, the infrastructure is managed by Public Health Wales in their own local data centres. My support team need to consider Public Health Wales in all of their upgrade paths. Due to COVID, we have to suspend the programmes. Future projects should consider built-in functionality that will make it easier to pause and restart programmes. Next slide, please. To summarise, the team delivered each product on time, to requirements, and within budget. Both programs are still running and have an active development schedule. Our Bowel Screening software is used by Northern Ireland. They reviewed all the home countries and chose the Welsh solution, which went live in 2010. We have an excellent working relationship with all our users. The team and myself are proud of what we have achieved. Finally, I'd like to leave you with one reflection. All screening programs have a similar concept. You identify your participants, you invite them, you test them, you manage the outcome. However, each screening program implements these very, very differently. Next slide, please. Diolch yn fawr.
Thank you very much, Stephen. We're happy to take questions or comments. We have some hands. I'm not sure who went first, but we'll go in. I can see Rowan. Would you like to come in? And then Marion, and then Helen.
Thank you, Ridian, and very sorry to hear about your dad. My mother-in-law, not an abdominal aortic aneurysm, but an aortic aneurysm, had treatment and had a fantastic outcome. So, you know, this is something that's well worth getting screened for if you're invited. Can someone comment on the cohort design and how you consider, you know, who's in the cohort for testing and who's not? Ridian, you said your dad had his aneurysm at 58, and we have a cohort, I think, over 65. You said, Stephen. So I think it'd be really interesting to understand what the risk factors are and how that was considered.
Okay, we'll Sharon, do you want to make a comment on that?
Yeah, thank you. Before I make a comment and response, I just wanted to echo thanks around this. So, Stephen, it's great that you've been involved in it for 15 years. And I think just to say, if we didn't have an IT system, we wouldn't be able to offer screening. You know, keeping the participants safe on that pathway is fundamental, and it's not easy. It's really, really complicated. So the more we kind of go into this, you know, and we do a lot of fail-safe work, so we're keeping people safe. So I'm really, you know, really pleased that this is a focus of this board. So in terms of answering the question, what we do and we offer in Wales is aligned to the UK National Screening Committee's recommendations. The UK NSC is a 4 nations meeting, and it has a whole list of conditions that we review on a regular basis, both should we be do screening and what should, you know, and also should we be continuing to screen. So, and it's based on the evidence. Now, the aneurysm screening is based on randomized controlled trial in terms of the base of the evidence of who we should be offering screening, and it's the reduction in mortality. So screening is not about finding things, it's finding things to make a difference. And actually the evidence showed that we should be offering screening in aneurysms for 65-year-old males because of the prevalence of that. And so that's what we've implemented. Now we call and we re-invite 65-year-old men, but actually men aged over that can self-refer. And that's a cohort that, if you like, has been reducing over time because we've been bringing on the 65-year-old men, and the older men have kind of self-referred in. So screening is offered for men 65 and older, but we call and re-invite the 65-year-olds as that eligible cohort as the first invitation.
Yeah, thank you, Sharon. And actually, people who have ultrasound is a very common investigation across healthcare. And we pick up aneurysms in age groups below this, and actually they can get referred to the vascular service, and they get engaged in the repetitive screening element of it. Just to highlight what Sharon was saying there in terms of why we screen, the Wilson criteria clearly state that it's got to be a test which is acceptable, that actually identifies the thing you want to identify, and that identifying it earlier makes a difference. So just to clarify that, Mariam, would you like to come in?
Thank you, Rhyden. Diolch yn fawr. I'm going to speak in Welsh. Diolch yn fawr am y cyflwyniad. Oedd yn gyflwyniad diddorol iawn. Ac dwi'n siŵr fel nifer o amgylch y bwrdd y bore yma, da ni i gyd yn gwybod am bobl sydd wedi cael budd mawr o'r gwasanaeth sgrinio bowel. Mae o'n hynod o werthfawr. Yn nodi bod yna ymhell dros filiwn o wahoddiadau wedi mynd allan i bobl yn yr oedran penodol rhwng 58 a 74 i gael i sgrinio. Faint o ganran o'r heini sy'n derbyn y gwahoddiad ac yn dibynnu ar y ffigwr yna, oes angen gwneud mwy i bwysleisio a chynyddu ymwybyddiaeth o bwysigrwydd cael y prawf yma a'i gael o yn gynnar. Felly dyna'r cwestiwn. Diolch yn fawr.
Thank you again. I'll pass that one to Sharon, please.
Diolch, Marion, am y cwestiwn. So I will reply in English, I'm afraid. My Welsh isn't good enough to reply,
No
but
problem.
I'll reply in English. So yes, so when we started the screening programme, Stephen explained that we moved from the FOB test to the FIT test recently, and one of the real main reasons of doing that is A, it's a better test, but also it's a simpler test, and the uptake we expected to be better, and most importantly the uptake in those of the population who were slightly less resistant to taking up the offer. So sorry to be blunt, men were not so good at taking up the offer as women, and also in some of the communities that were a little bit lower. We knew that the FIT test, because it was simpler, you had one test, easier to do, the uptake was better. Now, when we started the programme, we were getting the sort of the 55% uptake, which we were not happy with, and we did a lot of work around improving the uptake. We paused, as Stephen explained, over COVID. What's really interesting, when we restarted, the uptake really improved. So we're getting sort of 65, 68% uptake at the minute. And that's probably because the test is now simpler to do. What's really interesting is the failure rate of that test is really low at the minute. So people are really good at doing it, which is fantastic. And also, what we're seeing is sort of that sustained improvement of people taking up the offer. We do want it to be more. We're really, we're not that we're being complacent around that, and we're doing work in terms of doing the uptake. And interestingly, we're also working with DHCW and have done about sort of getting GP involvement. So GP sort of sending the letters around that, because we know that will improve the uptake. So we've seen an improvement. We want to continue to see that improvement, and also we think probably because people are more used to doing tests for themselves in COVID, that might also have helped sort of people go, oh, it's a test kit, I feel comfortable enough now to do that. So it's an improving picture, but we're not complacent.
Yeah, I think that's a very valid point, isn't it? People are used to doing home tests, point of care tests, as it were. So I'll bring in Helen now, if I could, and then Simon and Gareth.
Thank you, and thank you, Stephen and Sharon. Great presentation. My question's probably a little for both of you, actually. So what do we think the future opportunities are for this solution? So both from a digital perspective and also from the service perspective. So if I can ask Stephen and then Sharon to respond.
The current work program is looking to migrate it onto new hardware and data centres in Public Health Wales, so that's actively ongoing. We would like as well to send all the results into the National Document Repository, so they're available through the clinicians portal. So that's what we're looking to do. It would be good if we could look at a shared repository where the screening is a sort of a holistic approach, where they're not separate systems. So if you are on one screening program, the other screening program is aware of that, and they can obviously reflect on that if someone's going through some particular screening program, and if they've got an illness, that they're not invited onto another one, so you can bear that in mind. Yeah, we're actively developing all the time. As Sharon mentioned, we're looking to implement letters coming from the GPs rather than from the service, so it makes uptake increasing. We're developing new fail-safe reports all the time, trying to improve the system, reduce the complexity with all the different status codes, because there are a lot of status codes within the system. And one of the unique ones is I think we're the only system that goes into secondary care, where we allow specialist screening practitioners to manage pro formas and colonoscopy results. So it'd be good to extend that into secondary care.
Thanks, Stephen. I guess Sharon, from your perspective.
So as Stephen says, it's never status quo. It's always it's always kind of improvement, and we've done over the last few years quite a lot of fail-safe work. So we're really grateful for support from DHCW to provide us with sort of lists and some detail of the analysis of that. Again, checking that everybody's safe on the pathways. I think with bowel screening, we have a plan to fully roll out and fully optimize the program. So our aim is that we will be offering participants aged 50 to 74 bowel screening. That's the plan. It's going to take some time to implement that because it's colonoscopy capacity. So those numbers of people in that sort of database will sort of increase. And it's working together around that. So as we increase the volumes of the lists and how that kind of works is just going to be important to do. And then I think it's we've just talked about two of the screening programs. Actually, DHCW supports us with other screening programs, so the newborn and especially as well. So there's the sort of key bits. And looking to England, they're having to redo their screening programs IT, so it's keeping mindful of that and seeing where that would impact us as well. It's constantly moving and constantly looking to see what we can do with our IT to bring it in line with sort of being beneficial to the user and being as practical for the user, such as in the future maybe booking appointments directly and things like that are on our
Yeah, they're very
horizon.
valid, aren't they? And
Yeah.
you know, our culture is that we test, we learn, we test, we learn.
Yeah.
Small steps, but quickly. And the other thing I think, Helen, it'd be worth noting is the digital services for public patients and the use of the NHS app will be a communication tool for Public Health Wales to invite for screening services and to signpost symptomatic and asymptomatic people. Simon.
Yeah, thank you very much, Stephen. A couple of observations and then a question. And the first is linked very much to what you just talked about, Sharon, is that you know, as screening programs increase, as more and more people do it, there's a very happy consequence in which you pick up stuff early, but that obviously has implications for diagnostic capacity, as you've identified. And it also has implications for something that's very often forgotten and leads to enormous pressures, is that people who would otherwise have died will live much longer and will potentially go on to have other chronic diseases. And I think in our planning, we've just not really recognized that over the years, which is, so it's a great consequence, but it has implications for the system. The other observation, as someone who is very diligent at taking up these offers of screening, having I'm not looking around the table who else might have had the bowel screening. It is so, there's been 2 iterations, as I recall, from the first 3-day card, which was a nightmare, to the 1-day card, which was much better, to the most recent, which is just well, I wouldn't describe it as a joy, but compared to the 3-day card, it's it is significantly improved. My question is, and Marion asked this question a little bit in the beginning. Do we follow up on people who don't submit the test? Because that obviously has an implication for us in terms of, you know, the read across between the tests going in and those people who need to be sent a reminder. So in bowel screening, do we send a reminder? And I'm also interested in, and you may not have this to hand, Sharon, is whether there's a correlation between that group of, as you just overwhelmingly men who don't comply, but then are more like, you know, there is a more greater likelihood of those people actually, that cohort being susceptible to bowel cancer. And then of course I now know what I'm doing on June the 11th if I haven't had a letter next year. I should be self-referring.
Yeah, thanks, Simon. Can I not quote you that it was a joy to do? I'm loving that. I know you didn't quite say it, but thank you for that. You're completely right. And this is the work around inequity. So we've got an inequity strategy within the screening division, because we know we offer equally, so everybody gets an invitation. We absolutely send a reminder. So if they don't uptake their invitation for bowel screening, we will send them a reminder around it. We also sort of let the GPs know that they haven't taken up the offer, so that's what we have to do. But screening is an informed choice and it's not mandatory, so there's a balance around that, but we definitely remind them. We're also focused on exactly that you're saying, Simon. We know there's a it's going the opposite way. So the risk, I suppose, the prevalence of bowel cancer, if you look at it in terms of sort of gender and in sort of levels of deprivation, is one way, and then it's completely different to the uptake. So we know that if you're in a community of less deprivation, your chance of taking up the offer of bowel screening is more. So you're right, what we really need to be getting is the participants that aren't taking that up. So we're working with our partners, especially around the health board colleagues, around that inequities, and that's one of the real advantages of the new test kit, because actually that reduced the inequities, and we've seen a slight reduction in inequities as we've implemented that test kit. But as I said, you know, we've got further way to go around that.
Thank you, Sharon. Chair, in the interest of time, can we Gareth come in? We're just running over, if that's okay by yourself. Gareth?
Thank you, Ed. It's a very quick one. In fact, most of my questions have been answered already. It was around the frequency. So if I was offered a screening and I took up that offer, is it then an annual invitation back? Because I think the number of people that would then require those invitations grows because we're poor at uptaking it. So is it an annual screening? And the second part of the question is, what is the speed to further treatment if something is identified as part
Uh-huh.
of the screening? How soon before a person might expect further treatment?
So is this in bowel screening, Gareth, specifically? Or-
The AAA actually. I was
Okay,
thinking.
AAA. Okay, so in terms of the AAA, we would invite people, and then if they don't take up that offer, we would re-invite people. So they'd have two invitations, if you like. And in that second invitation, what letter, we explain to them that they can get in contact with us if they want to take up that offer in the future. So that's kind of the pathway of it. We have, as Ridin was talking about the size of the aneurysm, if the person doesn't have an aneurysm at all, they will be, that's it, they come out of the programme, job done. If they have an aneurysm, then we grade it in size, and we keep some men who've got a small to medium aneurysm under review, surveillance. So depending on the size, depends on when we bring them back to keep monitoring the aneurysm. And once it gets to a certain size, that's when we refer to vascular services, to MDT. And we keep a watch on the timeliness, and then they go on for monitoring or treatment. Does that answer your question with aneurysm?
That's perfectly clear. Thank you, Sharon.
Yeah, there is some complexity to it. Having repaired aneurysms myself in the early part of my career, the size and the actual general well-being of the individual is important to consider, because it's quite a complex and tricky procedure. And where the swelling is in the length of the aorta also determines what type of surgery you do. And vascular services and our endoscopy services are under pressure. Some of the things that we're doing as an organisation outside the screening programme, supporting endoscopy modernisation, looking at how we can deliver electronic test requesting for some of these procedures, how we're working with pathology services to improve turnaround times from biopsies taken from endoscopies, is all within our portfolio, and we'll probably hear about that in future meetings. I'd like to go back and thank Sharon for the way that she dealt with the questions expertly. Thank you. I really appreciate your support. And Stephen and the team, thank you very much for the work that you've done and that you continue to do. I'll hand back to you now, Simon.
Thank you very much, Ridin, very ably chaired. And I'd like to express my thanks to Stephen for the presentation, and indeed to you, Sharon. And I'm sure you'd love to be in control about the pathway time between screening and diagnostic, but that is another challenge that is in the system, as Ridin has talked about there. So thank you very much for answering those questions, Sharon. I mean, it's a really, really important area of work, and one where we bring the digital data worlds in partnership with the public health world, with real outcomes. I mean, huge outcomes for individuals in terms of their quality of life and length of life. So thank you very much, Sharon. If we move on then to my report, which you've had in your papers, there's a couple of things, was more than a couple of things, just a few things I draw your specific attention to. You will see in my report, and you will have seen probably a couple of weeks ago, that and obviously noted by Grace Quantock's absence today, that Grace was wonderfully appointed to be the deputy chair of a new organisation, the Citizens Voice Body, which is taking over all the functions of the community health councils from April next year, and adding another function in terms of their relationship with social care and local government, local authorities. But one of the key differences is between CHCs and CVB is that CVB will be entirely independent of the NHS. And in those circumstances, it clearly couldn't prevail that an individual could be a member of an NHS body, a board, and be a member of, and indeed deputy chair of, a Citizens Voice Body. So Grace, with great reluctance, decided that this was the next step on her career path, what she wanted to do, and understandably so too. It's, as you can imagine, the work on the Citizens Voice Body very much in the sort of areas of interest that of Grace's areas of interest. So she therefore resigned from our board, we wish her well. We wished her well, and I'm sure she'll do a fantastic job in that new role. That left us with an additional vacancy to the one that we already had as a result of Sian going on to be Sian Dole going on to be the chief executive of Bwrdd, and we interviewed for that role. It's a process that's run by the Public Bodies Unit, and the appointment is the minister's appointment. It's not in my gift or our gift, but we go through the process of identifying suitable candidates for the minister to consider. That process was completed. An individual has been appointed by the minister. Unfortunately, I can't tell you who that individual is at the moment, because they're currently going through what they describe as the pre-employment checks. I think they do a limited criminal records check and references and those sorts of things. So that process is going through, but we hope that that will be completed very shortly. We were hoping it would be done by this board meeting, but it hasn't. But it should be completed very shortly. There is then the opportunity, if others who were interviewed and were regarded as being appointable, for the minister to choose from that pool of people if another vacancy falls within 1 year of the interviews, which of course we are in the position of that being the case. So the minister has been asked whether she is prepared to appoint another of the candidates that the panel deemed to be eminently appointable. And we understand that the minister is currently actively considering that, and we're hoping that we'll hear very shortly that she has made another appointment, which would be great news for us because it will avoid us having to go through the whole process again, and will mean that we'll be up to our full complement of independent members very shortly. So that's where we are on that. I had a very constructive appraisal meeting with the minister, which I subsequently had a letter which is sings, it's not of me clearly, but sings the praises of the organization and all that we've done over the past year, both in terms of setting ourselves up as an independent, accountable health body in Wales, and the work that we're doing in digital transformation, and that highlighted by you may have seen recently a ministerial statement on all the things that are going on in terms of transforming health and social care using digital and data services, and I think there's a link in my report to that ministerial statement. The other bit of the appraisal meeting should be, but as yet to be, so I can't actually tell you what they are, or indeed tell my chief executive what they are, so that I can give her similar objectives. I don't as yet have any objectives for the 22-23 financial year. And as we sit here, I'm not cited on when that might happen, but I'm hoping it will happen relatively soon, because obviously if there are things that the minister is expecting of me and my objectives, then we need to have a conversation about how the organization can align with those. So I will update you as and when I'm able to update you on that. We had a very constructive meeting with the chair and a senior officer of NHS Digital recently, which was really helpful, and we went through some of the key elements of an independent report she produced on the future of digital in this case in healthcare in England, and that gave us a huge amount of food for thought about how we will work and what our priorities and strategies will be into the future. And we're hoping that we'll maintain a relationship with NHS Digital in what will be its new form as it's subsumed into NHS England in the not too distant future. And finally, just before that, there's a couple of other, Helen and I together met with the Older Persons Commissioner and the Children's Commissioner, and they were really constructive meetings. I'm not sure if you mentioned this in your report, Helen. They were very useful meetings in terms of our joint interest in particularly issues around inclusion, and indeed with children around some of the ethics of our future digital platforms. And finally, and something that we have welcomed and very much do welcome, you will have seen that a couple of weeks ago, I think it was on the 15th of July, there was an announcement that for the Public Accounts Committee and the Health and Social Care Committee were going to undertake in the autumn a joint review into digital health and care Wales and they've set some terms of reference around our work and the wider digital environment, and we very much look forward to that. We're going to be submitting written evidence by the 23rd of September, and then we are invited to give oral evidence to appear before the joint committees on the 26th of October. The joint committee reviews is something that's quite new within the Senedd. I don't think there have been many. I think it's really encouraging that the Public Accounts Committee have brought the Health and Social Care Committee into this process, because it does it means that they can cover off and address issues of both governance and transformation and what we're actually doing in health and care. So Helen and I are both looking forward to that, and in the 26th of October, and someone else around this table will also be looking forward to it, but we haven't quite decided who that third person will be. I think we're limited to 3 people attending, and we'll keep you up to date on the both our written submission and our conversations with the committees over the next couple of months. But as you can imagine, that we looking at our IMTP and our strategies, you can imagine what we're thinking at the moment. Our key narrative will be around sustainable funding, cybersecurity, and interoperability. Any questions or comments on my report? Happy to take any. If not, are you happy to note my report with interest? Thank you very much. And then I'm going to ask Helen to pick up on and introduce draw attention to any specific items in her report. Helen, over to you.
Diolch, Chair. Bwrdd, good morning, everyone. So just a few highlights from the last month or two. So in terms of the COVID response, I mean, it hasn't gone away for us. There's still lots of work for us to do in terms of responding to the changing requirements and the changing landscapes around the public health requirements. We're currently prioritising the work in the vaccination system to support the autumn booster programme. So that's the main focus of attention in terms of our COVID response at the moment, but a lot of other work going on there. We've had our regular staff briefing. We continue actually to get a lot of engagement, so thank you to staff for tuning in, and thank you to Sarah Jane for joining me on last month to give a bit of an intro to the wider staff. So again, we had over 400 of the staff on the call for that. Want to call out actually some of the achievements of individuals in the organisation. So we're really proud that Fran Beadle, our CNIO, was nominated for the Digital Leader of the Year award. She was shortlisted in the top 10 of those. So really proud of Fran for getting onto that shortlist, and very well deserved, and recognising the leadership she's shown through the nursing informatics programme and the development of the profession of the CNIO. So well done, Fran. And I'm proud to say that we have an award-winning Director of Finance amongst us today. So Claire has won the UK prize for the Digital Finance Leader of the Year. So it was never in doubt for those of us who know her, but well done, Claire. Really, really proud of you. And getting on to kind of updates on other areas. The digital medicines portfolio continues to make good progress. Actually, the portfolio of work now and the programs are really kind of taking shape and motoring now in their particular areas. There's an update on each of the portfolios there for you to read, and really good that the portfolio went to present to the IM network, actually, the IM digital network recently as well, to share the work that's going on. In terms of the exec director appointments, so this has been a constant, hasn't it, this last year or so in terms of getting the team in place. as you've seen, we've got Sarah Jane and Gareth on the call with us today. We've got as relatively new appointments uneven, but we're now interviewing for the Director of Primary Community and Mental Health Digital Services. That interview is next Thursday, so we're hoping to make an appointment following that process. So really confident of making an appointment, and a good appointment following that process. And we're now out to advert as of this week for the permanent position of Director of Operations for the organisation. Even and I had a really good face-to-face, we're doing a few more of those now, face-to-face meetings. It just feels kind of a bit of a revelation, actually, after 2 years of just remote working. But we met with Harriet Green and Myra Hunt, who are the co-chief execs of the Centre for Digital Public Services, and some great work opportunities ahead, really. And we'll take forward those conversations to understand how we, as the two organisations, can work together collectively, very much focused in how they support us in some of our kind of more work that we want to do around user research and user design, so and service design methodology. So yeah, really good conversation, and even we'll be taking that forward with them. And also in kind of the face-to-face theme, we've had a number of speaking engagements over recent months. Actually, it's been really great to get out again and to be able to, you know, tell people what we're doing in Wales in the digital field, and you know, the good work and the great work that's going on, not just by us, by Wales in general, really, in terms of the approach that we take in Wales. So myself and colleagues on the call and elsewhere in the organisation and in Wales attended the HIMSS conference in Helsinki in June. Really useful experience. We also attended the Digital Health Advisory Group Europe meeting in advance of the conference. It was really great to get into some of the discussions around trust and how we kind of work with the population and the public and the use of data, and how we kind of ensure that we have trust in that process. We're also building relationships with our commercial partners through the Tech UK Health and Social Care Council, and I think a really great opportunities actually to work with the industry and actually get a bit use that relationship and they really want us to use them, if you like, to kind of test out our ideas and thinking in terms of our future strategies and approaches. So I think a really helpful kind of discussion day that I had with them earlier in the month. And I also spoke at the Institute for Government and Public Policy's Healthcare Innovation and Technology show. So really good to be a part of that and to hear what's going on elsewhere in England and across the public sector, but also to be able to share again the good work that's going on in Wales. And a shout out to Rydian's team, to the information governance team who have revised the Your Information, Your Rights materials so that we can support that those materials out now to the wider NHS, so that we have information available to patients on their rights in terms of their information. And we also participated in the NHS Confederation's response on the Transforming and Modernising Planned Care and Reducing Waiting Times publication that came out from Welsh Government. And really the focus of our feedback was around sustainable digital funding and making sure that digital is actually at the forefront of the thinking of the recovery or reconstruction, whichever the word is, but actually it's about digital being at the centre of that, and actually maybe reimagining the way that we're delivering planned care and are able to support waiting lists. So look forward to further conversations, and I've been taking further conversations forward with the new Director of Planned Care in Welsh Government in terms of how we can support that agenda. They were the highlights really from me, Chair. Happy to take any questions.
Thank you, Helen. Anyone got questions or comments? Again, you asked to note that report with interest. Thank you. If we move then on to the next section of the agenda, strategic items, and the first is the shared listening and learning annual review that Rydian, you're going to lead on. Over to you, Rydian. You're on mute, Rydian.
You got me, Simon. Apologies. I hope that you enjoy the element of the board that brings us closer to understand the impact of the things that we do as an organisation that contribute to the health and well-being of the population in Wales. I think it's also important for our staff to hear these stories because we are part of the NHS family, and it's the impact of the things that we do, I think, are very positive on our ability to retain and recruit staff. So that would be a comment that I would make. Regarding the paper, Chair, I draw your attention to point 3. I'd like to just highlight to the board that 3.2, the learning themes that have come out of the exercise, which I think are valuable. You will always hear me talk about clinical leadership, engagement with the clinical workforce as a key enabler to deliver digital transformation, both in the early design and in the implementation. And I go back to that comment that I made earlier about testing, learning, listening, and retesting in that design process. What is pleasing about the presentations is that 4 out of those 5 have included attendance from partner bodies, and today was a very good example of how we as a key organisation within the NHS work as a trusted partner with the other key delivery bodies. I'm happy to submit that for noting, Chair. Thank you.
Thank you, Ridin. Any questions or comments? Claire.
So I would agree with the report, but I think there's something here about how we're developing our senior leaders in DHCW, exposing them and enabling them to present to a wider board, which is really, in some cases, taking them out of their comfort zone and developing those essential presentation skills. So I think not only do we benefit from engaging with our stakeholders, I think we're professionalising the organisation in our key leaders and leadership. And I think you saw that today with Stephen, but we've seen it across the year with many others. So I think that's also an important aspect of those sharing and learning sessions for us.
Very definitely. Thank you, Claire. Thank you, Ridin. I think they are absolutely key and key interesting bit of the board meetings. And I think your point about bringing in the ability you've had to bring in partner organizations, talking about how it works for them, how what we do and works for them is also a key contributor to the success of this particular item on the agenda. I mean, the one that I know is really, really difficult, but at some point get some people, Joe and Joanna Public, talking about how digital has made their care pathway either better or the lack of digital made it, disadvantaged it. But I know those are difficult ones to organize, but
I think they're worth doing. And I think probably when we in the near future with the NHS app, I think there will be an opportunity there perhaps to have a conversation with patients who've had an impact without going into their personal details of their complaints, because there's always that tension between people sharing things that are personal and private.
And indeed, it could be organisations whose role is to advocate on behalf of people who share common characteristics.
Ruth's got her hand up.
Ruth, I know, yeah.
Thank you, Simon. Thank you, Ridin. And I'd agree that they're incredibly useful and interesting presentations for us. And Claire's point as well is it is nice to see the other leaders from the organisation coming forward for this. On the topic of things that it would be nice to see, I think I would really enjoy seeing something around how we engage with the Welsh language across our digital services as well. And that would be something that would be of interest to us. And I know that I've put that on the agenda, and it's probably a more difficult one to come up with, but I think that is something that we should strive to have over the next short while.
Again, the app might give us that opportunity, Ridin, won't it, in terms of the way in which we're approaching the use of Welsh there.
Yes, I think both the public-facing element and, of course, the professional-facing element, and how we've I've been working to identify the language options preferred by those who consume the services. So I think that is something that I'll take away, Ruth, and do my best in the near future with Chris to work out how best to present that.
Thank you. Thank you. So we've been asked to approve this report. People happy to approve it? Thank you very much. If we move on to item 5.2, the recruitment task force and the lessons learned from the work of that task force. And Sarah Jane, you're going to take us through this.
Thank you, Chair. Thank you for the opportunity to present this lessons learned paper. It's featured from February 21 to July 22, so it's a fair period of time really, where I think the team that were involved had a huge amount to go after really with setting up the new organisation and putting new people into posts and indeed through-putting people in the organisation to some of the new roles. So it was quite a lot of activity to identify and track the recruitment activity and best support that in terms of attraction and campaigns and indeed retention. So I think I won't go through the report in detail, but there's been lots of achievements made in that space. And I think one of the big things for me is there's been quite a lot of establishment in the relationship piece across our partners and stakeholders in the education sector and in terms of lots of additional groups as well, which I think is really important. And that's something that I'll be continuing with and indeed promoting. I think in terms of the lessons learned piece, again, it's categorised in 3.2. But I think one of the big themes for the lessons learned is that perhaps the group needed more senior support in terms of some of the business leads across the organisation, both in terms of some of the job fairs and campaigns, and indeed as part of the group. I think the group had lots of ambition and enthusiasm, but indeed actually being able to execute some of the decisions and agreements made at the group back in situ and supporting that with some of the campaigns that were being taken forward probably didn't go as well as one would have wanted. And I think that is probably because the seniority of the group wasn't perhaps in a place where they could organise things en masse to take things forward. So I think that's something really that I'll come to at the final part of the presentation. There were some really good things achieved, and I think one of the other things that we need to make sure that me, my team, and indeed others working across, because I think this organisation is a really keen observation from me as a new director, is that we work across the holistic portfolio. We don't stick within our own area of specialism. We work very much collaboratively as a team. We support each other and get involved in each other's portfolios and support that to best effect. And this is a really good example where Ivan's supporting the digital directors piece with Helen, supporting that across the digital directors as part of the workforce review. So there's lots of things going on across that collaborative within the colleague group and indeed the chief executive, which is brilliant. And that for me shows that we're really high performing and collaborative organisation. So that's really great for me in terms of how we're moving this agenda forward. So in terms of the next steps, and this has already happened within the last couple of weeks. So I think we've made some good strides forward within the task and finish group, but I think what we now need, and we've agreed, is a more strategic resourcing group with senior leads across the organisation. I've volunteered to chair that with Michelle, who looks after performance and commercial, co-chairing and deputy chairing with me in terms of supporting that with a commercial contract to look at different avenues to bring resource in, both long-term resource and short-term resource, to look at packages of work as well as individuals, short-term contracts, building on all the things that this group and indeed my team and others have put in place already. But we've still got a lot of high volume to go after, and indeed this is in the risk register. So we've still got a lot of ambition to go after those numbers, and indeed we need to deliver on that. So there's lots of stuff that needs to be done quickly but effectively, and it needs to be sustainable. So there's lots of things we're putting in place there, lots of work that needs to be done, but again, a collaborative approach across the business is absolutely required. So that group has now had its inaugural meeting in terms of who is going to be supporting that. The first meeting in proper terms will be in, I think, about 10 days time, but we'll be meeting every 2 weeks and tracking that. And as I'm going to be chairing that meeting, it will be really helpful for the executive as well, that I'll be providing key updates at the executive in terms of the numbers, what we're doing, how we need further support so we can get that traction and buy-in. So that will be moving forward, and I'll provide updates for the board as and when required as well to make sure everybody is aware of how this is moving forward, hopefully positively, and we can get some traction on the numbers that we need to come into the organisation. And I'd welcome any questions or any clarification on anything.
Thank you very much, Sarah Jane. Please do put your hands up if you'd like to. Okay, I've got Ruth, then Rowan, and then David.
Thank you, Sarah Jane. It's just an offer of help, really. Let us as independent members know what we can do to support you in this. We're always happy to take the show on the road and, you know, talk to people, help you unlock our networks, discuss things that we can do to support either in practical terms or in championing things at the board. So let us know. My fellow IMs are all nodding. I am speaking on all of their behalf because I know that I know that it's something that we're all absolutely focused on and committed to as something really important for the organisation going forward. So let us know.
Thank you. I'd very much welcome that, and I'll be definitely taking you up on that offer. So yes, I'll be in touch. Thank you.
Thanks, Ruth. Rowan.
Just echoing the theme there that recruitment is everyone's job in the business in order to get the right talent in to deliver. So I'm really pleased to hear that, Sarah. And because we're being recorded and because we have other parties on the call, if I could ask you to just tell people who might be interested in a career with this exciting and dynamic organisation that is transforming Welsh health and care at pace through digital, where they might look for vacancies and the kinds of roles that we're currently recruiting for. Thank you.
Very good question, Rowan. Yeah, there's a variety of ways. All of our jobs go out on the NHS jobs platform. We've also got, and it's in the paper actually, a CV database as well, which is really helpful. It's got links into the members of my team, but it's got information for candidates, how they can apply, how they can put things forward, what sort of job opportunities there are. So there's quite a lot of information on there. It's a developing platform, and we will utilise that as we move forward with the business, but it's a good starting point. And if it's helpful, we can put an email, a generic email address as part of the actions for this meeting that go out to the wider community across Wales, so that if people wanted to access that as an internal route to my team, then more than welcome to provide that, if that's helpful.
David, sorry, apologies.
So I was just waiting for your prompt. Thank you. Thanks, Sarah. Thanks for the report. I think the task force has done a really great job in getting us up and running. And I welcome the establishment of the strategic resourcing group. I think that's really the next level to take it to. And I'd support what you've said about establishing the relationship with the supply chain so that we can draw on them. The one thing that I would probably add that you might want to consider, based on my experience of having to upscale digital organizations, is some of the roles that we will need going forward will be difficult to recruit into, and it's not roles that we would want to put out to the supply chain. So one of the things that I've seen in other organizations I've worked with is career pathways, where we identify ways in which more junior staff can get to more senior positions and the sort of skills and experience that they will need on the way. And if we do that for particularly some of those key roles, but I would advocate probably doing it broader, and then some sort of staff development program that sits alongside that, it would be much better for us to grow the people that we need into those senior positions, rather than have to rely on the recruitment market to fill them.
Absolutely, David. I think it's going to be a blended approach. So I think if we look at last year's statistics, I think it was about 53% from memory that were promoted from within, which I think is terrific. I mean, it certainly shows that we're supporting that development, that career pathway piece. But indeed, the the people in an organisational development strategy, which is in draft at the moment, which is going out for wider engagement and consultation across the business. That's going to have a key feature on development, career pathway, succession planning and talent. And actually, as part of this group, and I probably should have flagged this up earlier, that strategic workforce planning piece is an integral part in this group, which probably the task and finish, as you rightly say, David, was focused in on the immediacy of the task, to get the volumetrics in and to look at that as part of the organisation establishing itself. This is really going to be much more organisational focus for the future, as well as the immediacy, in terms of getting some traction on the numbers and bringing in the right people, some of which will be short term, some are longer term, and as you say, developing. So this will be about attraction, this will be about retention, this will be about development, career pathways, succession planning, talent management, leadership, and looking at that more holistically across the organisation with all of our partners out in the digital community and our stakeholders in the universities, education sector and so forth. So there's a lot to go after, but we're trying to join all the dots up so that we get the best for the workforce that we've got and we support them and develop them. But indeed, we are looking to be an employer of choice, so that we are attracting the best talent into the organisation and we want them to stay with us and develop their careers. And we're also looking at the jobs that exist now may also not be the jobs that will exist in 2 or 3 years' time. So it's really looking at, you know, working with our specialists and professionals in that digital arena within the organisation to say, how long do we need these skill sets for? What do we look for the next 2 to 5 years? And make sure that all of the, you know, the resources that we're investing across the whole of the workforce is to good effect. We don't want to develop something that in a couple of years is going to be not required. So it's trying to utilise us to the best effect really for the organisation and for the staff in that organisation to progress into some of the more senior and professional and roles that will exist in the future. So it's quite a complex piece. So it's quite a lot to go after, and as Ruth said, we're asking for support and help along the way to tap into all of your expertise and your external knowledge and contacts and networks to get the best for the organisation as we move that forward.
Thank you, Sarah Jane. Ridian.
Thank you. So Jane, you're to be complimented on the energy and drive and professionalism that you brought in such a short time, and I can definitely feel that energy across our workforce. So well done. I suppose there are elements of the paper which I think I'd like to draw out, particularly the partnerships with various groups that perhaps are previously perceived as being excluded from careers in IT, particularly women in tech as something that is important, and also the diversity agenda, which is key. I'm pleased that we're exploring that. My question to you is about the brand of Digital Healthcare Wales and how we promote that brand internally, externally, within the nation and beyond the nation. I'd be interested in what your vision is going to be about how we link the strong brand of the NHS to the strong, what I would hope to be the strong brand of this organisation.
Absolutely, and indeed, that's going to be a feature of this group as well, and it will be an integral part to the draft strategy that's currently in place. And I will be working with all of you really, and probably an external organisation to put that into place. But it needs to be fit for purpose. It needs to actually identify us as a unique organisation. So I just want to make sure whatever we're putting together in terms of that branding and marketing piece is going to have longevity, we're going to feel it and understand it and think, yes, that is this organisation, that does really identify with us. So I think for me, it's about tapping into the wider workforce as well, and getting some thoughts and feelings from them, especially some of the people that are perhaps coming to the organisation latterly, perhaps our future leaders and so forth. So it's really getting into the hearts and minds of sort of people perhaps haven't had a voice in the past. So we really feel what it's like working here, and really feel that sense of pride working for this organisation. And I think as Helen identified earlier, we've won lots of awards so far and continuing to do so. So that's a really good thing for people that are looking to join us, thinking, gosh, this is an amazing organisation. There's some really great people I can learn and develop from. And coming into your career at an early stage, certainly I felt this, and I know others said this to me over the years. You want to work for people that are inspiring, that are going to develop you, and work with colleagues that are ambitious and driven, and using cutting edge technology. So it's trying to brand and market all that up into one place. But I will be doing that with my vision, but also taking on board everyone in the board and also the wider workforce to make sure that we get something that really sort of fits for everybody, really, and everyone can identify with that and make that a really strong, even stronger brand, because I think we already have a strong brand, an even stronger brand for the future. And that will be that's a really exciting piece of work that I can't wait to actually get into, to be honest.
Thank you, Sarah Jane. That's great. I just got one question. Looking at your report and what you've highlighted in it, and the a not insignificant agenda that's ahead of you in terms of what you want to do, and also recognizing that this is never a job done thing. There will always be other things you can do. Have you got an idea in your head where you'd like to be sitting down and going, right, I've got the block, the building blocks of what we need to do in place? So is this a 12-month program to get you to where you are more comfortable that we've got what we need in place? And as I say, recognizing that it's never job finished, there'll always be things to do. But what's the timescale in your head around getting us from where we are now to where you think we need to be?
Yeah, I think that's a fair assessment, to be honest, Simon. For me, there are some immediate priorities that need to be taken forward. So I think we've already discussed sort of the recruitment piece, in essence, that the business and our AMTP and a number of other things are dependent on people actually in those roles delivering the business for the organisation. So I think for me, and I'm starting to work through this actually, to look at that prioritisation list and to make sure with Helen that's signed off and taken forward in that regard. There will be a number of things that can be done in parallel, and other things that will need to be pieces of work that will take a little bit more time, with my attention at addressing those areas. So I think it will probably be something we'll pick up at our one-to-one to have a look at that trajectory, really. But yes, I mean, it's not something that's going to be done in a couple of months, but there may be certain pieces of work which there are already started. So there's already things that are in train. There's the strategy on the horizon scan in the near future, and a number of meetings and groups that have been set up to support us moving this forward at pace, really.
Thank you, Sarah Jane. Anyone else got any further questions or comments? And we are being asked to, let me get this right, to note the report. People happy to note the report? Lovely. We're going to take a 15-minute break, folks. So it's currently 11:16, so we'll back here at 11:30. Thank you all. See you in a quarter of an hour. Sorry, folks, just unmuting myself. Welcome back after the break, and then we'll crack straight on into part 6 of the agenda, governance, risk, performance and assurance, and start off with 6.1, the finance report, and I'll hand over to Claire, the finance director, Claire Osmondson-Little, to take us through your report. Claire.
Diolch, Simon. Bwrdd, good morning, everyone. As usual, I'm going to hopefully bring the finances report to life and share and run through the position at Q1 with a number of slides. But before we start, I just thought I'd give you a bit of backdrop, really. This is the end of the first quarter of the financial year. We're 25% now through the year. And during that period, we've seen an uptake in COVID. Helen, in her report, highlighted the number of cases increased, and that was a genuine issue across Wales. But also we've seen inflation kick off and really start to hit. Something that actually we did predict and was in our annual plan, but something certainly as a finance community, we are seeing now the implications of rising fuel prices and general prices across the economy. And the other bit is that we've deployed our plan. So just like we'll talk about our IMTP plan, we've deployed our financial plan through our governance processes. So each executive director sat around this table has signed off their budget and their assurance to me that they will balance their plans at the end of the year. So for me, that's an important aspect of grip and control. And grip and control is really a common theme. So together with other health boards and trusts, as we proceed through the year, we're starting to see the challenges around balancing our financial plans and the context that we are now operating in a sort of post-COVID environment. So as a trusted finance partner, I'm going to take you through the DHCW Q1 position. I will highlight some of the key activities, particularly around COVID, but also around the Digital Priorities Investment Fund and our capital. Unfortunately, I will have to highlight some technical stuff. So we are implementing IFRS 16. So I'll talk briefly about that. And then I'll raise and share with you some of the risks and opportunities as a finance community we're facing. And hopefully at the end of that, the team will note and take note of where we are financially and assurance from that. So if I can move us on to the next slide, please. So I'm now going to focus on the Q1 financial performance. Next slide. And assure you that at the end of the quarter, we have achieved our statutory requirements. What do those mean then? So from a revenue perspective, we've broken even and we are 50k currently underspent in the quarter. From a capital perspective, we have an underspend of just shy of 57k, but we've actually reported a spend of 87, and I'll share with you where we're spending that. We've achieved our public sector payment policy, which has a target of 95%, and we've actually achieved 98. And again, our cash balances are in line with where they should be. And I should also say that this is quite an important month for us now as we move into quite a significant cash movement and payment process. So good underlying fundamentals in terms of our financial performance. So I'm now going to, if we move on to the next slide, look at the revenue run rate. So what's the revenue run rate? This looks at our spend every month in relation to both our pay and non-pay. The ones in the red boxes are our actuals, and then the ones going forward then are our forecast and our current forecast position. What this shows is actually our run rates are starting to increase, which is what you would expect. They are heavily influenced by the Digital Priorities Investment Fund phasing. So you'll see peaks and troughs in non-pay, particularly in March, and I'll come on to that. And also then following the recent, Sarah Jane's presentation on recruitment, you can see that our pay run rate is going to increase by 800,000 between where we are now and where we will be at the end of the year, with kick-ups in September, but also in Q4. So that the importance of that activity to underpin that run rate will be really important going forward. And then equally the non-pay. So the non-pay, has been relatively flat. not surprising really, and a reflection, I think, of something we'll pick up later on the digital priorities investment funding and activity. And as you can see, towards the end of the year, that picks up with a particularly high predicted spend in the end of March. A couple of things there really is that there are circumstances where pay and non-pay boundaries shift as we might choose, or digital projects might choose to switch from recruitment to external support. So we may see some changes in that classification as we go through here. But our focus in the finance team is really trying to understand why that kick in the last quarter is in place. And that really reflects some of the DPIF phasing. And again, as we look at DPIF in more detail going on, I think that reflects a lot of uncertainty around funding, reflecting the confirmation from Welsh Government on some of the funding letters that we are expecting. So that's our run rate. If we move to the slide, so that shows us our pay and non-pay. This shows from a DHCW perspective how each of the directorates are performing in relation to their plans and their planned trajectory. It really reflects where we are as an organisation with that delay in recruitment or the lag in some of the recruitments of key positions, but it also shows significantly a cost pressure within ICT area in particular, really reflecting some of the resourcing issues they have, but equally some of the pressure points there. So within the other directorates, predominantly that's a reflection of the recruitment position and the vacancy lag, but actually the key thing there then is getting and working alongside Gareth and the team to understand the underlying financial issues in ICT. So that's where we are at the end of Q1. And if we move on to the next slide. So we're in a position that we have a savings plan for the year that has got a target of 2.5 million roughly for the year. And we anticipate that a lot of that, 46%, we'll be able to get recurrently. So what that means is we are looking, and you can see from the Q1 savings performance actually, at a number of areas where we can reduce our spend perpetually by around about 1.1 million. But that does leave us with a 54% non-recurrent element of our savings plan. And what that chart shows you is the first quarter performance, which is highlighted in red. And you can see that pay efficiencies dominate that savings profile. And as we move through the year, that reduces. And as we would expect, as our recruitment profile and the work that Sarah Jane is leading takes real hold. But equally, we've got some non-pay reductions. So the chart, I know it's very small, apologies, in the middle really shows that, summarises that Q1 performance. And as you can see, pay efficiencies were actually generated, were higher than planned. So we were 1.2 million of pay efficiencies against a plan of about 1 million. So again, it reflects, I think, the position we are in terms of really recruiting to all those positions. And again, there are a number of other initiatives that we are looking at, including the IT maintenance and support, the travel reductions. Q1 has certainly seen the levels, although we've seen an increased number back into the office, quite a few of our employees are working from home and equally not travelling to meetings that are now done on Teams. So we are seeing the benefit of that. Together with other savings that we are looking through the non-pay groups. Okay, we move on to the next slide, please. So as you know, DHCW have been supporting the COVID response. And this is really a game of two halves, if I'm honest, from a Q1 perspective. We have the TTP, the track and trace aspect of the COVID initiatives. You can see here that we have spent, in terms of non-pay, around about 1.1 million, and again, pays around about 400,000 to date. And if you noticed on the graph below, that spend profile is predominantly non-pay and is influenced by the number of licenses. And together, working alongside Welsh Government and other stakeholders in the Pathway Group, we have reduced significantly from July the number of licenses, therefore reducing that cost significantly going forward, all of the things being equal, of course. Whereas I think on the right-hand side, although our non-pay is smaller, and you can see it's only 692, but our pay is 428 in the quarter. What we are seeing actually is a real focus within the vaccine system, developments in readiness for the vaccine rollout, and I anticipate those costs will remain and potentially grow towards the end of the year. But again, we share those monitors with the relevant groups, and we are also working closely to ensure that those forecasts are in line with thinking. So let's move on to the next area of key spend, which is our Digital Priorities Investment Fund. So this shows the capital allocation and our capital performance for both the Digital Priorities Investment Fund and also where we are in relation to the spend to date. What you can see here is that certainly from the ones in dark blue are where we've received funding confirmation from Welsh Government. The ones in light blue is the ones where we have not yet seen hadn't had formal confirmation of letters from the Welsh Government, and that will really influence our ability to commit without that level of commitment. So those are so we've actually been requesting formal confirmation, although having said that, we are working hard where we have confirmation in spending that allocation. So in the first quarter, we've recorded just shy of £600,000 worth of spend, leaving us with 2.4 million to spend in the remaining 3 quarters of the year. So we've made good progress in those areas. Can we move on to the next slide? So this then looks at the Digital Priorities Investment Fund as a whole, and you can see that we anticipate in total about £33 million worth of revenue, together with the 3.6 million worth of capital. And again, I've highlighted in dark blue and light blue where we've had funding allocations confirmed and where we're awaiting funding letters. And what we've done on the right is show where we've spent against those programs to date. So you can see the NDR has started the quarter well, together with other aspects of our digital schemes, in particular WPAS and the nurse care record. So yes, we are progressing well, but we would gain assurance more fully when we get the letter formal confirmation, which is on its way from Welsh Government. Okay, next slide, please. So our DHCW total capital performance. So the Digital Priority Investment Fund is an important part of it, but actually we have our own discretionary allocation that which is cut by 25% this year. And what dominates that spend profile is really the investment that we are doing to upgrade our networks. During this quarter, as a board, you've approved the procurement of the network, and really now it's about ensuring delivery and implementation planned for Q4 of this financial year. And again, as we are distinctly aware, the supply shortages in and around chips, but also on general hardware in informatics is a risk, and we've captured that issue here to acknowledge the fact that we have placed the order and we now have a delivery date, but it's something we will really have to keep an eye on to ensure that we commit those funds in this financial year. So that's really that dominates the discretionary spend. The Digital Priority Investment Fund is around about 3 million, and then we've got track and trace and COVID related capital spends of around about £500,000 that generally are progressing well and have done during the quarter. So if we move on to the next slide. So this is a copy of our balance sheet. As you're aware from our year-end accounting reporting in the last board, our assets are around about 30 million, and we are one of the highest in Wales in relation to intangible assets, which really reflect the systems that we have in place in and around DHCW. Again, during the month, we've seen some movements in cash and debtors. And again, This is reported and done through the monitoring returns, and we've got a grip on those. So if we move on to the next slide. So I did mention a bit of a technical finance reporting requirement. We have moved as part of the International Financial Reporting Standards, IFRS 16. We now have to report anything with a value of over 5,000 that at least that might be subject to capitalisation. So it will move from a P&L or a revenue reported expense to a balance sheet capital item. There are a number of items that that fall into that category from DHCW, and the revenue and balance sheet implications have been reflected in our accounts and will be going forward. So that's really just for note, and it's a common issue across NHS Wales that the accounting standard is now coming in, and we are now complying with that requirement. Okay, move on to the next slide, please. So I've now come to the risks and opportunities, and here I really want to reflect some of the comments I made at the start. Really, we are seeing now the implications of the inflationary pressures. We identified 2 exceptional costs as part of our IMTP, and Welsh Government have accepted and will fund those, well, will allocate that risk centrally. So from a DHCW perspective, we submit on a monthly basis those cost pressures, and they are taken centrally. But I also want to highlight concerns I have around the digital inflation and supply cost increases. I touched on it in the capital. We are seeing supply chain shortages in key areas, which inevitably leads to increases in demand. But equally, we are seeing price increases that potentially will come into effect from the next financial year across a number of our licenses and systems. And we are working, the finance team are working to evaluate the impact of that. And I think that the calculations we've currently done for next year look at a potential digital inflation rate of around about 17%, which again is quite significantly higher than the underlying current rate. So we are looking at implications and mitigation around that through the next quarter, and obviously flagging that into Welsh Government as a digitally inflation impact. The Digital Priority Investment Fund activity is progressing well in some areas, but I think it's true to say without formal confirmation of funding, the profile of the future spend throughout the remaining part of the year is a concern. And again, together with the SROs, we're working closely to understand the implications and the effect of the decisions that they may or may not be taken as a result of that not having formal funding confirmation. And again, we've raised that concern with Welsh Government. The other bit is point to make here is that, as you know, DHCW doesn't stand still. We're working hard to understand the implications of improved cyber security, but equally of our forthcoming data center contractual end, which is in the next financial year. And again, I wanted to raise the fact that those will require additional funding. And again, on a backdrop where current capital budgets are cut, but equally other health boards and trusts are really struggling to balance their books. As you can see, you know, ensuring these priorities are considered from a Welsh Government perspective is really a key priority for us from a financial perspective. But it's not all doom and gloom. There are some opportunities. So from an opportunities perspective, I've put vacancy management, and again, that's a poison chalice really, because on the one hand, there's a financial gain for non-recruitment, but actually as DHCW, we really want the activity. But again, as you saw in the first quarter, we saved 200,000 approximately higher as a result of our vacancy positions than were planned. And again, I think working closely with Sarah Jane to ensure we really maximise the opportunities, whether they're internal or external, over the short term to bridge that gap is something we will be focusing on and are focusing on in quarter 2. I did mention there about the additional travel reductions. Although Helen is getting out to Helsinki and travelling around and promoting DHCW, our travel expenses generally are down. and that again is an underlying trend as more of our staff choose to work at home or can work from home, and the benefits of that, both from a CO2 but also from a financial perspective, are something that we could look at. The other point to raise is that the finance team have been doing some work in and around our VAT recovery in relation to digital spend. We have identified potentially around about £12 million worth of national savings for NHS Wales as a result of our VAT treatment. Some of those are already have already arisen. The large majority, though, we will be working on together with the HMRC over the forthcoming year to do that. And finally, as part of the COVID response, DHCW enabled many of its workforce to carry their holidays over. And again, as those holidays are quite rightly taken, those provisions are being released. And again, those do have an impact potentially on our financial position. So in summary then, Q1 has seen us progress well against our statutory requirements as DHCW. We are starting to feel the bite of the inflationary pressures coming in, and we are forecasting the impact of the digital inflationary aspects of this for us, but also for the broader NHS in Wales. We are progressing well with our COVID response and foresee greater activities in the vaccine programme and forecast those the potential increase in cost in that area for the second half year. Although we've reduced our commitments around the track and trace, and you can see those in that graph. The Digital Priorities Investment Fund, the seeding of our digital innovations, is progressing well, albeit the profile of that spend will become increasingly important with any further delay in formal notification on the allocations. And finally, we are working on initiatives that will take that will require funding for next year. We're flagging those up now once those numbers are clear, so that they don't get lost in the priorities list within the forthcoming requirements. And finally, it's not all doom and gloom, but there are some opportunities, and where they are, we are working hard to capture them and ensure them for DHCW and for NHS Wales where applicable. So finally, to the next slide, I'm requesting the board note the financial report for Q1 and our achievement of our financial targets. Thank you, Simon.
Thank you, Claire. If you take the presentation down. Great. Okay. Questions, comments? Rowan. David, then.
Firstly, Claire, I think we all understand why you won your awards, because that was a first-class job of telling the story and showing how multiple balls are being juggled. I reflect that really for me, it's kind of we're the first time as a board that we're into this period, and I just wondered how unusual it is not to have funding confirmed by month 4 of a year, just so that we can perhaps get a sense of what that means. Are we in uncharted territory, or is this normal?
I think there's a Tom Jones song coming on.
It's not unusual. I won't sing that. I won't get an award for that one. But yes, I think in some respects it is. So there's two things that really are influencing that. One is that, as you're aware, towards the end of the last financial year, we had notification of the capital reduction and a reduction in the Digital Priorities Investment Fund, which was really late in relation to the plans that have been in place. And Helen and Evan and the team, together with the digital peer group, worked hard to understand the challenge and to prioritise with the directors of digital peer group those reductions in the most effective way. So that did add to the delay of issuing funding letters. I think it is notable that we are now 25% of the way through the year, and there are still a number of schemes where that clarity isn't there. But we had assurance in our JET meeting yesterday that they will work closely with us to issue those as quickly as they can now, and understand the reasons for the delay. So I think it'll be interesting to see in our forthcoming board if those actions are undertaken and that clarity is there. But it does make it very difficult for the SROs of those schemes to then plan effectively around recruitment, and given that a number of health boards are under significant financial revenue pressures, they are reluctant to take on a further commitment without their assurance. So it does create, as an intermediary in many of those projects, it does make the phasing of that spend and therefore the run rates for DHCW very difficult to predict. So we have got some work to do in collaboration with them to clarify that.
I think just to add to that, Claire, it also underpins the importance of our conversation around the sustainable funding model into the future to try and move away from annual funding cycles. Because even with an annual funding cycle where the agreement arrives a couple of months before the beginning of the year, it's difficult enough. But then if it's an annual funding cycle and the agreement doesn't arrive until Q2, it's enormously difficult.
Simon, you're absolutely right. And if you the recruitment is one of the biggest challenges, and we saw from Sarah Jane all the activities that we are planning to really turbo boost that over the next couple of quarters. The reality is we're in a very competitive market, and trying to get short-term specialist skills with limited funding and limited commitment around the timescale does restrict our ability to create stability for the organisation, but also in terms of our funding stream. So I think as a new organisation, we should learn from that and help Welsh Government in terms of trying to understand the options about how we structure it in a far more efficient and effective way that is a win-win. Because with when you have a longer planning horizon, you can make a further commitment and therefore the pricing, but also the resources availability becomes greater. So I think that's a big opportunity for both parties, having experienced what we're experiencing now.
David.
Can I just follow up on that, Simon?
Yeah, go on.
So yes, and I think there's two things that obviously as a board we need to kind of read across. One is if that funding doesn't emerge as we might expect, and clearly we've had some assurances at your JET meeting, but looking for alternative funding sources for key programs takes time. So there's that uncertainty, and then there's the read across into having that risk overarch other risks that we're carrying on the corporate risk register, and perhaps we can talk about when Chris shows the business assurance framework, because I think this is an everyone problem, obviously not just yours.
Yeah, that's right. So I think we have, and we'll come on to risk in a minute with Chris, we have actually added to the risk register this month the impact of the non-funding and the notification of the funding. But you're right, our ability to respond and react, we want to be front foot. We're eager to run at pace, and obviously having clarity on funding would really help that.
I think just before you come in, David, on this point, if you don't mind, I'd be interested in your view on this, Claire, is when the Welsh Government talk about alternative sources of funding to DPIF, they're actually talking about health boards, and what you've said about health boards in terms of the difficult financial situation then has an implication around the ability to actually secure that alternative source of funding. Yes,
because they, digital falls into their other, along the other list of all the other priorities that Health Board and Trust quite understandably has. So yeah, that is a concern that we would, that we get the balance right, I think.
Apologies, David.
Thanks, Simon. Thanks, Claire, for the presentation. Very clear, very precise. Thanks for that. I've got a clarification around what we've just been discussing, which is the DPIF funding and the impact on both capital and revenue spend. From what you've said and the conversation we've had, it sounds like we've got a very small window where we can recover the situation, How long is that window? Is first question. And then second question is with regard to the digital inflation figure you've given at 17%. I just wanted clarification. Is that an actual figure? That's what we're actually seeing in terms of the payments we're making, or is that an estimate of where we think inflation is going to get to?
Thank you, David. It's lovely to have a question on digital inflation. Thank you for that. But so I'll take that one first. So what we are currently doing is evaluating all our non-pay spend and allocating the contractual increases that we know about, but estimating, looking at the market prices, what are they doing? So I'll give you one example. There's one in particular supplier that is quoting 30% increase, and others are, and we've got some that are quoting 7%. So I've tried to calculate what that would mean from a DHCW perspective, and that's where I've got the 17% from, which is looking at, and some of those I know for certain, and some of those are a guesstimate, but it's really to give an indication as to how does digital cost prices compare to other market or health related costing, and also to flag it in so people understand percentages and they get then the context in which we're talking about. So that's where I got the 17% from. What's our window of opportunity? That's a difficult one to answer because there are quite a number of programs and there's quite a number of contractual and non-contractual spend. So I can't give you like a deadline. If we don't know by this date, then the red flag comes up, and I wish I could. What I could say is that we are working closely with each programme and listening to our health board colleagues to understand their ability to do the work. Procurement takes a number of months to put through a governance process depending on the level of spend. So there are some things that we can do quite quickly. There are other things that health boards and trusts will take longer. But I certainly think if we don't have notification by the September, then that would really flag in a major concern, because at a time when health boards and trusts are really struggling to balance their books, it would be wrong to us to hold on to money that we couldn't then spend. So I think I'm trying to get the balance right to say, come on, we've prioritized our digital spend. We've worked collectively to do the best we can with the resources we've got. Let's get on and do it. And that's the sort of message we're sort of sending in at this point in time. I think it's true to say, and I think there's a willingness to do it. I don't think it's that they don't want to do it. I think there is a willingness to work with us to get that clarity. So I would say we will review it in September, because that's when I think we would be looking at our next year's plan, because if we don't spend it this year, there has consequences for our allocation for next year, and next year is going to be really tough, I think.
Thank you, Claire.
Simon, I think you're on mute.
I'm on mute. There we go. Marion and then Ivan.
Diolch, Cadeirydd, a gain ategu fyny olch diffiant i Claire am adroddiad hynod glir a chynhwysfawr y bore yma sydd wedi cyfoethogi'n dealltwriaeth ni o'r heriau yn ogystal â'r cyfleoedd. Ond mae'n cwestiwn ni yn ymwneud â'r targed arbedion, targed o 2,5 filiwn o bunnau, a ydych chi'n glir iawn wedi amlinellu bod 46% o'r heini yn rai cylchol, recurrent, sy'n golygu felly bod llawer iawn mwy na'r hanner yn rhai sydd heb fod yn gylchol. Ymhryder i felly ydy a'r cwestiwn, oes a beryg yn bod ni wedi'n storio problemau ar gyfer y flwyddyn nesaf. Ac mae canran cymharol ddechan ydy'r targed arbedion o'n trosiant, o'n cyllideb ni. Mae'n dal yn arian sylweddol.
Diolch, Marianne. It's a really good question, and thank you for that. Not all health boards and trusts are undertaking a savings plan this year, given their financial position. So we have detailed a savings plan. Your observation is right. There is a carryover into next year of non-recurrent savings. And because of that, I've indicated in our carry forward deficit a 1.3 million deficit. That aside, we have a responsibility to ensure that we operate in an efficient and effective way, and each one of my colleagues around the table has a responsibility to ensure they generate value for money. So there is a non-pay and group, non-paying capital group, and they do, together with procurement colleagues, look at any opportunity we can. So as a result, as I said, we are we've highlighted as part of our monitoring terms an underlying deficit. We are the only statutory organisation in Wales that's highlighted a carry forward deficit. And given where we are with inflation, given the fact that we will have to pass those costs on because we are limitedly funded, and those costs may have to be passed on to health boards or trusts that are currently under significant financial pressures, I think it's true to say that this year we are confident in our ability to deliver a balanced plan. I think next year is going to be challenging, and we've raised our concerns and shared our concerns, and therefore we've got a piece of work to do that really captures all of these items, whether that's the DPIP rephrasing as a result of the funding letters, whether that's the inflationary digital aspect, together with our ability to save, considering our financial environment, and then work alongside our colleagues in Welsh Government to get guidance on what is the best way forward to us to ensure that we have a sustainable footing to really deliver value through digital in the NHS in Wales. So we have got a bit of work to do between now and September, I would say, to do that detailed piece of work.
Diolch, Claire, thank you.
Ifan.
Diolch, Simon. Just sylw wy'n credu yn strategol yn rhannol yn tynnu ar y cyswllt wi a Helena bobl eraill wedi cael mewn digwyddiadau wrth bod ni'n teithio gwmpas y wlad i ddeall beth sy'n digwydd yn y sector yn ehangach. A wy'n credu mae'r casgliad yw bod yr heriau sydd o'n blaenau ni ddim yn mynd i fynd i ffwrdd yn gyflym iawn. So yn gyntaf, o ran chwyddiant digidol, mae hwn ar draws y sector yn ei gyfanrwydd yr holl ffordd o'r agwedd broffesiynol trwy i'r cwsmer a consumer. Mae Amazon newydd roi, mae tro cyntaf ers 8 mlynedd, dwi'n meddwl, cost prime lan o 20%, a mae'r subscription services yn gwneud yr un peth, a mae hyn ar draws y sector i gyd, a mae hwn yn mynd i barhau. O'n sgyrsiau ni gyda y cwmnïau, sawl un ohonyn nhw yn gyflenwyr allweddol i ni yn bartneriad, Imes, a Kainos a bobl eraill, maen nhw fel ni yn brwydro'n galed iawn i recrwtio, cael ein anodd iawn i ffindio staff. Mae hyn yn dod trwy yn y sgyrsiau ni'n cael gyda nhw am yn ei adroddiadau cyhoeddus i'r rheini ohonyn nhw sydd yn gwmnïau sydd wedi rhestru. A maen nhw'n gorfod gweld cwtogi ar ei elw nhw, ar y profit margin, oherwydd bod nhw'n gorfod talu mwy am bobl dros dro neu yn y farchnad. A ni'n cystadlu yn ei herbyn nhw am yn staff ni, so mae hwnna'n mynd i barhau am gyfnod hir. A wedyn o ran y sefyllfa ariannol, o'n profiad i gyda Llywodraeth dros y blynyddoedd, dyw e ddim yn anarferol bod llythyron yn hwyr yn y flwyddyn yn dod allan. Beth sydd really wedi newid, dau beth sy'n ni'n tynnu, ar un yw bod na ddim dealltwriaeth ar y cyd o beth sy'n mynd i ddigwydd dros y 2 mlynedd neu'r 4 mlynedd nesaf, yn arfer bod byddai'r cylch ariannu i'r Llywodraeth yng Nghymru o'r Llywodraeth yn Llundain yn un eitha sefydlog, eitha hawdd i'w ragweld, pawb yn gallu cynllunio dros 2 mlynedd, a felly byddai pawb yn cymryd rhywfaint o hyder o hynny. Ac yn ail yw'r negesu caled iawn sydd yn dod oddi wrth y Llywodraeth ynglŷn â glanio o ran perfformiad ariannol, a mae'r ddau beth yna at ei gilydd yn meddwl bod y llythyr yn bwysicach o lawer, y llythyr ffurfiol, yr ymrwymiad ffurfiol yn un bwysicach na mae fe wedi bod o'r blaen. Ac os ni'n edrych ar beth sy'n digwydd o ran y Llywodraeth yn San Steffan, dyn ni ddim yn mynd i weld sicrwydd yn yr arian cyhoeddus sydd yn dod i Llywodraeth Cymru yn y blynyddoedd yma sydd yn dod. Felly mae'r sefyllfa sydd gyda ni ar hyn o bryd yn mynd i barhau, a mae'n mynd i fod yn her barhaol i ni.
Thank you, Ifan. Did you want to come? Well, let me just, I've got a couple of points, Claire, and you can come back then, and I think everyone, I mean, the first is, and you know, I've had this conversation on a number of occasions, and thank you, Marion, for raising it, is the risk around delivering cost saving on the basis of vacancies, because it has an operational risk because we're not filling the vacancies, and for every pound we do that way, we just add it to what we've got to save next year. I think we need this conversation as well, where if we have cost savings plans, then it is in effect a reduction in our budget, because and not an easy one to achieve. I think we're about 70-30, aren't we? Pay, non-pay, which is slightly better than in terms of the wider health service, which is about 80-20, but it still means that you've really, well, in an organization that's increasing its staff and needs to increasing its staff, you've only got 30% of your costs to actually go at. And that in the context of the inflation you've just talked to us about. So I think, we need to be having these conversations with Welsh Government around the nature of the what cost savings plans are doing to us, really, in terms of our ability to grow and to deliver the transformation at pace that we are being asked to do. So it is a risk. I know it's one that Claire is well aware of, but we should all be aware of it. The second bit is that it may not be a big thing, but it's just the capitalization, the change in the international financial reporting standards. Claire, if we've been asked to capitalize or required to capitalize things that were previously revenue, and we've got really tight capital budgets around, is that going to cause us a problem in terms of the availability of capital to fund those things that were previously revenue?
So these are not unplanned. So as part of our annual planning and our IMTP submission, we have been looking at the IFRS impact, not just us, across Wales, and Welsh Government have enabled that adjustment to happen. It's a nil cash adjustment. It's just a shift from one to the other, in effect. So that's what we've done. And then reflecting on the comments that you've made around the non-recurrent aspect of our savings plan, and really to offer a bit of assurance around our estate is moving from legacy to a more robust and a more with greater foundations. Our shift from Blaenavon to our new data centre actually facilitated the removal of legacy equipment and the legacy service costs of servicing those, which has enabled us to deliver recurrent savings. So as we are responsible for DHCW to ensure that we get value for money for the pound that is invested in us, so that when we go and ask for additional funding, that there's an acceptance that funding will generate good benefits and good returns for the investment. And I think that's the challenge for us as well, as to how do we articulate more effectively the benefits that generally sit outside DHCW, but they're benefits nonetheless for Wales, in a way that enables decision makers to really understand the impact that we have as an organisation. And I think that's something through the benefits work that I'm doing with my team, but alongside my colleagues, is really thinking of the outcomes and deliverables that we deliver. And I am really proud of the work that we did in the COVID work, for example, where for a very low capital and revenue investment, we facilitated and implemented national systems across Wales, which enabled them to successfully vaccine or contact things. And I think that's the role model each of us around the table has to deliver, is that when we do deliver services, we use our employees because we equip them to do that in an efficient way. And from a non-pay perspective, we really look at economies of scale wherever we can and leadership in that space, but we really do try to get value for money. And that's part of my role, but it's also part of every role around the table. I think if we can demonstrate that and really demonstrate what costs we would need to be a sustainable organisation, and because we've done our homework, we know our stuff, and we understand and influence that, then there's a number of choices that needs to be made. And I would hope, given that analysis, that they would choose the right one and look to us to really lead in this space. But we've got some work to do to get that together.
Oh yeah, indeed. I mean, I've often thought of the cost improvement programs as a bit like peeling an onion. The more layers you take off, the more likely it is to end in tears. So thank you for that, Claire. Any other comments or questions? Well, yeah, there have been a number of observations, Claire, about the clarity of the report and the way in which it's presented, and turning some quite difficult to get your head around stuff into easy or easier to get your head around stuff. So congratulations on that. This is no doubt why you were deemed to be the champion finance director across the whole of the digital world in the United Kingdom. So thank you very much. I mean, on a serious note, that was a really very helpful and easy to understand report. We're asked to note that report. I'm sure everyone's happy to do that. Yep, thank you. And then I'm going to move to the Integrated Organizational Performance Report, and it'll be introduced by Ivan, the Executive Director of Strategy, who's joined by Michelle Sell, Director of Planning and Performance and Chief Commercial Officer, who I'm sure will be presenting the report. So over to you first, Ivan.
Diolch yn fawr iawn, Simon. So wy'n diolchgar i Michelle bydd yn cyflwyno'r adroddiad. Dwi eisiau rhoi a bydd cyfeillion eraill yn cynnwys Gareth yn siarad yn erbyn rhannau o'r adroddiad. Dwi jyst eisiau gweud ambell i air cyn bod ni'n cychwyn. Mae'r ddogfen hon yn ddogfen allweddol i'r corff. Ni'n defnyddio hi'n gyson yn fusol yn ein bwrdd reoli. Mae fe'n un o'r prif ddogfennau ni'n defnyddio fel tîm gweithredol mwyn cadw golwg ar beth sydd yn digwydd. Mae fe hefyd yn adroddiad lefel uchel, strategol. Dyw e ddim yn ceisio cynnwys yr holl fanylion ar bob rhaglen i ni'n ei ddarparu. Mi fyddwn ni'n sôn nes ymlaen prynhawn yma yn yr adroddiad cyffredinol mewn mwy o fanylder ynglyn â prif raglenni strategol. Adroddiad perfformiad yn erbyn yn prif mesurau perfformio yw'r ddogfen hon. A be ni'n ceisio gwneud yw amlygu'r bethau sy'n mwyaf pwysig mwyn rhoi sicrwydd i'r bwrdd. A mae fe felly yn ddogfen sydd yn cysylltu'n agos iawn gyda fframwaith a sicrwydd bydd yn yr eitem nesaf. Mae'r ddau ohonyn nhw yn asio at ei gilydd. Byddwch chi'n gweld sut mae'r themau strategol, gyda ni 5 strategic mission, a wedyn mae yna 12 portfolio. Mae rheina yn yr IMTP, mae nhw yn y ddogfen perfformiad, mae nhw yn y Board Assurance Framework, a ni'n ceisio defnyddio hwnna fel sgerbwd sydd yn llifo trwy pob peth i ni'n gwneud. Yn bennaf mwyn cadw pethau mor eglur a fedrwn ni. Chi wedi clywed bore yma o'r trafodaethau cymaint mae'r corff yn dilifro ar gyfer yr NHS ar draws Cymru. Sawl faint o wasanaethau gwahanol i ni'n darparu, a ni'n ceisio sicrhau bod yr wybodaeth yna ddim yn mynd yn ormodol. Un peth weithio tynnu sylw at yn arbennig yw, wy'n rili bles gyda sut mae'r adroddiad yn edrych. Felly mae'r adroddiad yn un gyfarwydd i chi gyd, ond mae fe yn edrych yn wahanol, a ni wedi gweithio'n agos gyda'r tîm mwyn ceisio gwneud yr adroddiad yn un sydd mor lan a phosib. Nid just mwyn wneud iddo fe edrych yn neis, ond fel bod e'n haws i'w ddarllen a bod e'n cyfleu y wybodaeth bwysig hyn yn fwy eglur. So wy'n diolchgar iawn i'r tîm am y gwaith maen nhw wedi gwneud. Nid dim ond ar adroddiad hyn, maen nhw'n gwneud hynny o ddogfennau eraill. Mae'n cymryd lot o waith mwyn newid dogfennau sydd yn ddegau o dudalennau mewn i fformat gwahanol. A wi hefyd yn diolchgar i'r tîm oedd ar draws y sefydliad i gyd, achos mae pawb yn cyfrannu at y ddogfen hon. A mae yna gryn dipyn o waith yn mynd o dan yr wyneb fel petai mwyn i ni cael adroddiad i'r bwrdd a'r bwrdd reoli yn fusol. So wy'n diolchgar i bawb sydd wedi gwneud hynny. Mae'n drosglwyddo i Michelle ac i gyfarwyddwyr eraill sydd yn siarad i'r papur, a wedyn dewn ni nôl i gwestiynau os yw hwnna'n iawn ar y diwedd.
Thank you, Ivan. And I was just going to start just by running through some of the key changes to the report. Obviously, some of you will be very familiar, some perhaps less so than in the way this report is presented. And I would echo that. Thank you particularly to the organisational performance team. We've done a lot of work on this, but working with colleagues right across the organisation, which you can probably see for yourselves in terms of the content. So the main changes, as Ivan suggested, are really to try and support the conversations and the understanding of the board about where we are in terms of delivery against our strategic objectives. So the flow down from the integrated medium-term plan that the board approved and that we're delivering against this year is to try and really draw that out and be clear about where we are in terms of progress and any issues that perhaps we need to think about as a board at a strategic level. As Ivan indicated, we have an even more detailed version of this report, you'll be pleased to hear, at our management board, and then within specific directorates in the organisation, we drill into the detail. So you'll notice that we've retained the scorecard at the front. So I think the scorecard hopefully gives a bit of a snapshot of the health of the organisation as a whole, I like to think, and particularly against the key KPIs that we've put in place for the various areas, and I'm going to touch a little bit on that. And then we've got, again, as Ivan said, the bit of a reminder on the 4 missions, if you like, that we set out in our IMTP that we really wanted to focus on as an organisation, the 12 enablers and portfolios. So they're in the report really, so that we create that flow. The plan on a page, again, hopefully colleagues will recognise, is from the IMTP. And it does show on a quarterly basis the kind of key areas of delivery that we were expecting. So we've retained that, and we will continue to indicate highlighted in green where delivery has been achieved. And then we move into the kind of key difference really. So for each of the 12 enablers and portfolios, we've now added some a bit more information or information in relation to those points specifically, I think, about what's been delivered in the quarter, so a bit more of a drill down really, or work in progress in those particular areas. Starting to fill out, what does that mean? So, we've done some really good things, but, what's the impact? What's the benefit in terms of the work that we're doing? And then situations of note at the bottom. So anything particularly, I think, that we wanted to draw to the attention of the board, either as something that's being managed through the organisation or something that needs to be escalated. And as I said, the overall theme of that, I hope, and you can test me on that as we go through the year, is to be creating a bit of a story for the board and for our external audience, actually importantly, in terms of the progress that we're making and where we are in terms of achieving those objectives that we set for ourselves. So that's the kind of presentation. Probably also we're saying this form of report we are now proposing to bring on a quarterly basis to the board in line with delivery against the quarters. So I wanted to call out a couple of things, and we've called these out really in the cover paper because I think these particularly require discussion. We had a good conversation in the management board recently, and I think we felt that on the whole it had been a good quarter. It's a careful good, I think, in that we'd seen quite a lot of delivery, but as colleagues have indicated in earlier sessions, we've got some challenges that we're continuing to manage. So it's a kind of balanced position, I think, for quarter one. We have had some significant achievement, and we've called out there the Welsh Patient Administration System. A lot of work going on there, particularly up in North Wales and in other parts of Wales, to be fair, and really pleasing, I think, in this quarter that the users or the hospitals in the west of North Wales, so it's a very big area, as Marion will know very well up in North Wales. For those in the west, so in the Bangor area, they are now using the same system as their colleagues in the central region, so around Glan-Clwyd. And what that means, that's actually quite a big shift actually in terms of support for patients. So it means that we can start and manage patient pathways right across the patch now. It wasn't possible to do that previously. It means they can get wider use of things like electronic referrals, which again really helpful in terms of patient flow. And it also means that for those, particularly in the West, who've joined the new system, they get access to functionality that just wasn't available in their old system. So they've got, things like ophthalmology referrals and some of the functionality that was really helpful in the response to COVID. So things like virtual consultations are now available to a much wider user group up in North Wales. So that's really key delivery. The last part of that journey, if you like, is the users in the East, then up in North Wales, and they've got their own instance of WPAS that they currently operate, but their plan is that they will come together as a health board, and they're planning to May in line with the health board timescales for that. So particularly wanted to recognise that, and big thanks to the project team and to Carl Davis and the WPAS team. I know there's an awful lot of work has gone into achieving that. And indeed, I think Gareth may want to comment on that a bit further. So Carl's one of Gareth's key teams. So really good work. The other point, and again, it's interesting, it's come up a few times in the discussions already this morning, which was around the Welsh Immunisation Service. So I think Helen indicated first, we are continuing to develop that. So it was initially a response to the peak of COVID and the need to get the vaccinations out, which we were able to support really well. We're continuing to develop, so we're maintaining the team. So one of the key aspects of delivery in this quarter was around overseas vaccinations actually, and also, I should be careful, not overseas, but UK wide. So in terms of Scotland, Northern Ireland, and the Isle of Man as well, being able to bring in the data. So people who've been vaccinated in other areas, we've now been able to bring that into the core system. So that has a number of benefits, not least that clinicians have got the whole record, but also members of the public as well. So I don't, if the COVID pass is indeed needed going forward, then it does mean that it will pick up, wherever you've had those vaccinations. So that's really helpful, I think, moving forward. And they've also made updates. Again, we've discussed a number of times in terms of Welsh language, so that the system is now able to fully support those who wish to engage in Welsh, so members of the public who wish to engage in Welsh, which is obviously very important, and also two-way texting. So that's an ongoing development really in terms of that particular system. So just a couple of other notes I was going to raise before I hand over perhaps to colleagues. So 2 key risks we've called out in the report. Again, we've already discussed a number of times in the session this morning. So our people, and I thought SJ gave a really good summary there of all the work we've been doing in the last year and the real focus. Looking forward to that, SJ, as we move forward into this year, because it's about recruitment, retention, development of our people that we had a really good conversation about, and then also with my commercial hat on, how we can really maximize a relationship with other partners, and particularly in the commercial and other sectors. So we will work on that together in terms of how we can really get some momentum behind that. And the other key risk again was around the COVID-19 workload. So the kind of developments we're talking about in the immunisation system, those are in our plan. So we have a plan to continue to develop those products, but obviously if the pandemic takes a different direction, or if there are other demands that arise, then we always carry that position that we may need to divert staff again in order to support the response. Helen mentioned we're working toward the autumn booster, and I guess it's difficult to foresee, I think, in the medium to long term at this point how that may be required going forwards. So the last point then on the scorecard, so you'll notice there are 3 ambers, no reds on the scorecard. So 3 issues, important issues, because they're areas where we are not meeting the KPIs that we've set. But I think I'm not raising them as significant concerns or risks at this point. One of them is in relation to an audit action. We have an agreed way forward. And in fact, we'll be discussing that at the next audit committee to ensure that we are comfortable with the course of action that we're taking, and that we've got an appropriate level of scrutiny on that. So I think that one, we have a plan. Highlighted about the SLAs, because this is part of our engagement. It's only part of the engagement, but with our Health Board and Trust colleagues, and in terms of the level of service and performance that we're providing to them, and their opportunity really to discuss that with us and to shape that going forward. So it's noting in the report that not all of the meetings were completed as we'd hoped. I would have to say that was really at the request of partner organisations who wanted to move those. So, best will in the world, there are lots of conflicting priorities at the moment, but the team will, really keep on to that, because I think it's important that we have those sessions regularly. So noted just there in terms of the KPI and appraisals. So I think we're not doing terribly on our appraisal. So we're up at 79% now, which is actually pretty high. The target's 85, and we've talked about this before, really key area. And I know in terms of the management teams is something that we are certainly very focused on with the support of SJ's team, although I have to, as I often remind my team, it's not a workforce responsibility to make sure that we are supporting and managing our staff. It's all of our responsibilities, and I know that colleagues do take that seriously, and I think we are making a lot of improvements in those areas. So that was the key things that I wanted to particularly cover. I was just going to hand over perhaps Gareth. I don't know if you wanted to noting the significant development from one of your teams, but also anything you wanted to pick up in the operational area. I guess I'll hand over to you.
Thank you, Michelle. Yes, on the operational service management side, it's worth noting that the performance for June did dip. Now that's largely due to a few things, namely sickness, COVID, absence, churn in staff, but also the extraordinary long weekend that we had over Jubilee weekend, which has skewed our figures somewhat. There was one major IT service incident. You'll notice a change in terminology. We had this discussion at board previously where we used the term significant IT incident, which was very subjective. So we have modified our terminology now to bring it in line with more of an ITIL framework. So it's a major IT incident now is the terminology we're using. The incident itself didn't breach its SLA. It was a time synchronization problem. Our servers are very time dependent. And in this instance, time didn't seem to be a constant. There was a drift and it caused an outage in W limbs, but was restored relatively quickly. There is some good news on the desk, which I would like to shout out, actually, that despite some of the challenges they've had around churn and sickness and bringing new staff in to train, the customer satisfaction scores themselves have increased and are actually very high considering. While our abandoned call rates have increased slightly this month, we can identify why that has been, but our first time fix on the desk still continues to increase. You may notice if you look at the slides, you'll see that it's almost plateauing. This is quite normal. And the way to get that to increase further, which we've already started, is to get more responsibility down from level 2 and level 3 engineers onto the service desk so that they're able to fix more complex issues first time. And that's a piece of work that I've started with Ian Cox and his team, who are hungry to get more engineering skills on those desks. So that's something we'll do, and I should envisage that those stats are then going to increase even higher. I think that's really all I wanted to call out. Actually, if there are any questions, I can't see my screen at the moment.
Well, I mean, on that last point, Rowan and I visited the service desk at the beginning of the week, and which is a very interesting presentation by the leaders, and then we visited the desk itself, and I listened to a very happy customer being sorted out, and then the day after I was a very happy customer being sorted out. So yeah, I mean, many congratulations to the service desk. I've got a few people want to come in, Helen and then Ruth, and then okay, Helen, Ruth, and I'll bring the others in after. Helen.
Thank you, and thank you, Michelle, and thank you, Gareth. I guess just to congratulations from me really to the team, to the WPAS team and to the team at BCU. I think we can't underestimate the huge undertaking that has been to move forward that agenda up there. And actually, I think both teams reflected back that it's been the smoothest PAS implementation that they've experienced. Now, that is saying something. As a veteran of numerous PAS implementations, they are majorly disruptive implementations across kind of hospitals and across pathways. And actually to have it's so well managed and so well coordinated in such tight teamwork. I just want to, it would be remiss of me not to call it out, to be honest, Chair. It was, and the feedback that we've had, I've spoken to Joe, the Chief Exec up in BCU, and Dylan Roberts, the new CDIO up there, and yeah, things are going well. So it bodes well for this, the full single instance across the entirety of the health board that's scheduled for next May. So just wanted to call out to, again, as Michelle did, to Carl and the team there for us for a great job, well done.
So it's next May that the Eastern, the Wrexham area comes on stream. Yeah. Okay.
Yeah.
Ruth and then David.
Thank you, Michelle and Gareth, for those updates. I've got two questions. Firstly, Gareth, on the service desk, it's really good to see that they're clearly still knocking it out of the park in terms of their customer service, and I think we've all experienced, excellent work from them in the past. Given that they've got vacancies that they're carrying and there's a slight increase in sickness, be interested to know what we're doing to make sure we're taking care of their well-being. They're clearly working really, really hard and doing a good job. And then my second question is around, there's a lot of green on this on this dashboard, which for an organization where we have noted so many of the pieces of work, the funding position is not yet clear. We've got a challenge around recruitment. I'm just wondering when we might start to see some of that reflected across our green picture.
So Gareth, before I come to you, David, Gareth, do you want to pick up on the first point? Michelle, are you probably best placed or to start, and then Ivan looks like he wants to come in as well. So Gareth, do you want to pick up on the service desk support question?
Yeah, certainly. Thanks, Chair. Yeah, it's a good question, Ruth. the service desk, it's always a concern through COVID whenever we send people home to work. Having had, a lot of experience working with service desks who have gone and tried to do that duty from home, mental health has been significant. And in my previous role, very significant, and a lot of, young kids, of which they generally are in that desk, would go on to leave the company. It's paramount. It's something we keep a very strong check of, and actually the latest feedback I've been getting when I've been speaking to people on the desk is they're very comfortable because we've given them everything they need to work comfortably from home. So it's not a challenge. And in fact, the only thing that came back as a criticism really functionally was the telephone system. That if we can get that more to a sort of a cloud soft phone approach, which is exactly what we intend to do this year.
You should speak to somebody about that, Gareth.
It's the one thing that we want to do quickly, and that's absolutely in line to do with the new E5 licenses and everything we bought through Microsoft. Yeah, I keep regular check with Ian. Ian keeps regular check with his team. Tracy is a fabulous service desk manager, and it is the #1 priority. What I've been attempting to do through the service desk, because they do have a lot of churn. You bring people in, you train them, and then they get excited by other opportunities in DHCW and they move away. I, for one, celebrate this, the fact that we can keep people within the business and they move to service management or they move to other areas. And I've been trying to sort of get this message across. This is a good thing, guys. Let's embrace this. So we're trying to monopolize on that. And something we're looking at perhaps is as people come through the service desk and we train them, maybe train them in service management as well. And then we give them a bit of training in infrastructure, a bit of training across application and development, so that we encourage this churn. And in speaking with Sarah Jane a few weeks ago, we almost need this constant recruitment piece, not just recruit to replace. We keep almost an open recruitment system, knowing that we're going to develop staff and we're going to move them, more importantly, keep them. So that's the mindset we're looking at now within the service desk.
Thank you, Gareth. And who wants to pick up first on the when are the risk, Ivan, and then...
Yeah, os gai ddod mewn gyntaf. Gyntaf, gai just ychwanegu at WPAS yn y gogledd. O'n i 4 wythnos neu 5 wythnos mewn I gweithio gyda DHCW a fi oedd y cyfarwyddwr on-call yn ystod yr wythnos pan oedd PAS yn mynd yn fyw yn beti, oedd e'n wythnos nerfus iawn, ond mi nath e fynd yn llyfn a mae hwnna yn credit i'r tîm. Mae'r adroddiad yn dangos ein perfformiad yn erbyn ein cynllun. Dydy hynna ddim o reidrwydd yr un peth a'n perfformiad yn erbyn yr holl bethau bydden ni eisiau gwneud mewn byd perffaith. A mae hwnna'n drafodiaeth i'r bwrdd, dwi'n meddwl, ynglyn â sut I ni'n mesur hyn. Felly ni'n edrych yn ofalus ar sut I ni'n adrodd, gwyrdd neu coch, ond ar hyn o bryd, mae hwn yn adroddiad yn erbyn y mesurau mae'r bwrdd wedi cytuno a beth sydd yn yr IMTP I ni'n gweud bod ni'n eisiau cyflawni, ac yn amlwg mae beth I ni'n gosod i'n hunain fel cynllun ar gyfer y flwyddyn a'r flwyddyn nesaf. I ni'n gwneud hynny gan wybod beth yw'r cyfyngderau sydd arno ni o ran y staffio, o ran yr arian a'r cyllid ni'n cael oddi wrth y Llywodraeth. Bydden ni gyd, mi'n siŵr, yn cytuno bod llawer iawn o gyfleoedd I ni wneud lot mwy. A wrth bod y adroddiad ma'n setlo lawr dros y chwarter nesaf, wrth bod ni'n mynd mewn i'r broses cynllunio ar gyfer IMTP blwyddyn nesaf, byddwn ni fel bwrdd yn gallu cael sgwrs arall ynglyn â beth I ni'n gosod i'n hunain fel uchelgais.
Thank you. Michelle, did you want to add anything?
Yeah, thank you, Simon. Yes, I absolutely agree with what Ivan is saying. And I think the scorecard aspect particularly, Rowan, it's a balance, I think, in terms of the management approach. So some of the things in the scorecard I would consider to be our kind of core responsibilities or our ability to operate as an organisation. And I mentioned about the PDR. So we do try and focus resource into those areas. And that's the balance off then against the newer things, as Ivan's saying, that we would like to do, isn't it? So I would hope that we can maintain a fairly green picture in our scorecard, because those are underlying provisions which are really important to us. And as I say, our health as an organisation. And then it's looking at resourcing, isn't it, for all of the new things that we want to take forward. If I could, Chair, if you could just bear with me as well, I was going to pick up on one of Gareth's points, if that's okay. And I'm going to follow up on Rowan's recruitment pitch, because I was talking to a colleague yesterday, I was in the office yesterday, and he was telling me about someone who he'd encouraged to come and work for our organisation on the service desk. And it was a career change. So through COVID and various other things. And one of the things that was really great, he felt, was that, you know, he had the opportunity to make that change, and because it was quite flexible actually, so he was able to work from home some of the time, it was a much better fit in terms of his, you know, his family and his life, and actually he was really enjoying, you know, joining the organization, and it was a really positive change from something that he did before, which was quite different. So I think that, you know, it is, I think by you know, if we can look at how we can maintain that flexibility going forward, I think it creates a lot more opportunity perhaps for different people to come and work for us, and then, as Gareth said, to develop all the way, that's our new chief execs, as you know, at some point, because it's a great way into the organization.
Indeed, indeed. David, and then Marion.
Thanks, Simon. Thanks, Michelle, Gareth, and Ian. Some observations from me, really. The first is around the report itself, Michelle. I've watched the evolution of this over probably 9 months or so now, and really pleased with where we've got to with this. So it's ticking most of the boxes for me. I note in regard to Portfolio 11, Research and Innovation, that we're undertaking a review of what's going on in the wider NHS and probably Welsh Government. Lots of innovation going on, and looking at how we use that to inform our objectives going forward. I think that's a really positive development. And then the last observation I wanted to make around Portfolio 12 was we've got a lot of good deliverables in there, which is great to see. It would be helpful going forward if we can start quantifying some of those deliverables in terms of value. It's difficult to measure value against innovations because I've had experience of doing that. So it's not the easiest things that I'm suggesting that we do, but if I link the ability to do that with the ability then to get a sustainable funding model, that for me is a key to unlocking that model, because if you can start quantifying the value of the things that are being delivered, particularly as NDR comes online and we're getting more and more opportunities to deliver value, I think that will help with the funding situation. So it's a request for me really to take a look at that if we can. I know it's not an easy thing to do, but I think it's got huge potential to help the organisation going forward.
Twice in a day, come on, get a grip. I think there's general agreement that that should that's a sensible approach. Marion, and then Rowan.
Diolch Cadeirydd, ac fel byddwch chi'n disgwyl, mae'n braf iawn gen i fel cyn aelod o Fwrdd Iechyd y Gogledd i glywed bod WPAS bellach yn ei le, ac yn ei le yn llwyddiannus yn ôl pob golwg yn y gorllewin. Da ni wedi trafod yn gynharach heddiw pa mor anodd ydy crisialu a diffinio deilliannau a buddiannau o beth o'r gwaith yn ei wneud. Ond fel rhywun sy'n ymwybodol iawn o'r anawsterau a fi yn y Gogledd wrth drio ymdopi heb WPAS, dwi'n meddwl bod yna unrhyw amheuaeth bod hwn yn mynd i osod sylfaen gadarn i'r Bwrdd Iechyd i allu grymuso o ran effeithiolrwydd ag effeithlonrwydd yn symud ymlaen. Ac dwi'n meddwl y bydd cael y tri rhanbarth ar draws y Gogledd, cael y dwyrain yn dod i'r un sefyllfa a'r ddau rhanbarth eraill yn newid y tirlun yn sylweddol. Ac jyst i ddweud, mod i'n falch iawn, mae wedi bod yn amser hir yn dod, ond mae'n braf gweld WPAS yn ei le, a bod y berthynas rhwng DHCW a'r tîm yn Betsy hefyd wedi bod yn un mor adeiladol, felly llongyfarchiadau mawr gen i a diolch am y gwaith.
Check I'm not on mute. Thank you, Marion. Rowan.
A couple of observations. Firstly, reflecting on my day out with our glorious leader to the customer service desk. I just wanted to put on record really that is a phenomenal team that we have, capable of a lot, I think there are more ways which we could perhaps use them within a customer service situation, but given them a slightly broader supporting remit across the organisation than necessarily sucking the talent out. I did get a little bit of schooling from the senior management, which I salute them for, because I'm quite a forceful personality, and they dealt with that with aplomb. So I was really impressed with them, and listening to calls, and certainly things like perhaps doing some of the system testing, collaborating across with application development. Not only could they do that, it'd be a great way of training them with systems and giving a bit of voice of the customer feedback in development. So I think that's some food for thought there. A sort of observation on the report. One of the things that kind of I remember from the first time that we started seeing this, things like statutory mandatory training, we're now well above our internal target, but our internal target is probably quite low to what I would see in industry. So I just wonder whether, in that pursuit of excellence, that raising our bar, we might consider moving, what our target is a little bit higher, just to keep that continual improvement piece going. Just food for thought on that. And then finally, that piece I think is going to be mission critical that David mentioned. I think that the challenge you've got is this board report has an envelope of 12 months. So if you see programs that we are putting in foundational work on now, that things like the digital medicines portfolio, where the development of a Welsh medicines record allows us to build on top and starts to address some of the real challenges, like 20% of ER admissions we learned recently are due to the consequences of current medicines. Lots of opportunity to build on top of that would then have a real benefit to the health boards that we work with, but we never get to there unless we can do the first piece. So having some plan of what that value releases to the system over several years, I think will help Claire and her team build those arguments and sense of shared ambition with some of our customers that will help sort of that paying into the development curve pot a little bit earlier than perhaps just a sort of release of time kind of argument might have. But thank you. Good report.
Thank you, Rowan. Ivan, you've got your hand up. You may want to come back on.
Yeah, diolch.
In general, some of the comments.
Wel, just pigo lan ar y sylwadiad wrth Rowan ynglyn â rhai o'r rhaglenni strategol i ni'n rhedeg ar ran yr NHS yng Nghymru, fel oedd Rowan yn gweud. Mae rhain yn rhaglenni mawr trawsnewidiol sydd yn rhedeg dros sawl blwyddyn, a maen nhw'n rhai sydd i gwerth nhw yw sut maen nhw'n llwyddo i drawsnewid gwasanaethau iechyd a gofal a sut mae rhain yn cael ei darparu ar draws y system. Mae gyda nhw fel arfer, mae gyda nhw llywodraethiant nhw eu hunain, edrych ar y Digital Medicines Transformation Portfolio. Mae yna fwrdd rhaglen, mae yna SROs ar gyfer bob un o'r rhaglenni unigol, a wy'n credu bod e'n rhywbeth falle gallwn ni drafod fel bwrdd neu gyda'r unigolion er mwyn gweld ble yw'r lle gorau i adrodd ar gynnydd yn y ffordd mwyaf tryloyw oddi wrth y rhaglenni hynny. Mi fyddylen nhw i gyd eu hunain fod mor agored a phosib ar draws yr NHS. Dyna lle mae'r prif randdeiliad, dyna lle mae'r partneriaid sydd yn darparu ar gyfer rhai rhaglenni fel WCCIS, y rhaglen gymunedol, mae awdurdodau lleol yn rhan o'r llywodraethiant. Felly wy'n credu bod angen i ni feddwl trwy beth yw'r cyfuniad priodol o'r gorolwg a'r sicrwydd mae bwrdd DHCW yn cael fel endid corfforaethol, a sut mae'r rhaglen ei hun yn rhoi sicrwydd i'r holl randdeiliad ac ar draws y system gan weithio fwy yn agored. A falle bod hwnna'n rhywbeth sy'n werth i ni drafod sut orau i wneud hynny.
I think that's an absolutely important conversation that we need to have, Ivan. And just one observation for me on the report, because there was a figure that just jumped out at me and hit me between the eyes, and it's an indication of much of the success in the rest of the report, and that's the sickness level we're currently running at. I mean, any other health body in Wales would do an awful lot to have a sickness level of 2.53%, as Marion would recognise, and as Andrew and Sarah Jane probably recognise, a high sickness level is often indicative and can act as a proxy for lots of other things in terms of the way in which people are being managed and people are being supported. And one assumes the opposite is also true, that if you have a low sickness level, which 2.53 in the health service really is, it must be an indication of something going well in terms of the support that teams are getting from their managers. So, I mean, congratulations on that, because I thought there was a digit missing when I first looked at it. It is a remarkable figure. Anyone else got any other comments, questions? No, thank you very much. So we've been asked to discuss, which we have done, and review, and obviously receive and accept that report. Thank you very much indeed. If we move then on to the board assurance framework, which members of the board know we've done a lot of work on crafting over recent months. So Chris, over to you to introduce the board assurance framework.
Jock, Simon, thank you. So I'm going to talk through the cover paper, item 6.3 in the pack, and then I'm going to bring in executive leads to talk through the relevant areas of the report itself, the strategic missions that they're responsible for. So I'm just going to recap, because as you say, Simon, we have done a lot of work on this over the last 6 months in particular. So the board assurance framework report itself is designed to give the board timely information on what our principal risks are to delivering our strategic missions. There's 5 strategic missions, and how the organisation is managing and mitigating those risks through identified controls and assurances in place. So included within the report is the initial the initial risk score for each of the 5 strategic missions and principal risks, and the target risk score that we're trying to move those principal risks down towards. There is a red, amber, green assurance self-assessment, which is undertaken by the lead executive for each strategic mission. And as we work through the paper, I'll bring in each of those strategic leads to provide their assurance on where they feel we're at in terms of their strategic mission. Before I talk through some of the changes that have taken place since our last board meeting within the report itself, I just need to highlight one error, which is the wording in Principal Risk 3. It says leading to better health outcomes, and it should read leading to poorer health outcomes. So thank you, Rowan, for picking up on that. It's in the cover paper as better. So just for the minutes, that needs to be reflected as poorer. So just working through, picking up where we got to at the last board meeting, we agreed and approved the dashboard report template. But what we did say we'd do was some additional work to finalise the risk appetite for each of the strategic missions and to validate the overall gap action plan with the exec leads. So I'm pleased to say that we had a fair amount of time on this at the last board development session, and the risk appetite for each strategic mission was discussed there on the 30th of June. So the table under section 3.2 in the paper sets out our stated position, and this comes to the board today for approval in terms of our risk appetite position for each strategic mission. So I'm going to work through these just so we're clear. Enabling strategic mission 1, the platform for enabling digital transformation supporting joined up consistent care. We've put as having a cautious risk appetite, so DHCW will accept a small amount of risk in ensuring compliance with information governance and some information security, cyber security and standards. So we are cautious on strategic mission 1. Strategic mission 2, delivering high quality technology and data products and services. Again, we're saying we've got a cautious risk appetite. So DHCW will accept a small amount of risk in the provision of secure and resilient high quality digital services, particularly live services, We have said where we're developing services, we will take more risks. So that's one caveat with that one. And then expanding the content availability and functionality of the digital health and care record. We've said we'll take a moderate risk appetite. So we will accept risks to deliver successful expansion of the digital health and care record with input from users. Strategic mission 4, driving value and innovation for better outcomes. We have said we will take an open risk appetite. So we will, DHCW will accept that we are going to take significantly more risks in pursuit of driving innovation to achieve better value and evidence by improved outcomes. And finally, becoming the trusted strategic partner. We have said we will take moderate risks. So again, we will take some risks to achieve this strategic mission. And I think the key thing here in terms of these risk appetite positions and statements is that they do move beyond just statements. So if approved by the board today, we should expect to see our behaviour reflecting these strategic missions, these strategic risk appetite statements. So where we're saying we will take an open risk appetite, we should see much fewer controls, lots of empowerment, and risks taken in order to achieve those objectives. Likewise, for the areas where we're saying we will be cautious, we would expect to see that we do have significant controls in place to manage and mitigate those risks. So discussions have taken place with each of the exec owners and the operational leads to finalise the action plans and the detail that sits behind the board assurance report that you see today. And there were a number of items that were identified following our last discussion that are set out under in the table under section 3.3, mainly relating to the trusted strategic partner, strategic mission 5, that have been added into the report, just for everyone to be aware of that. In addition to those changes, board members should also note that a number of controls and actions relating to strategic mission 4, particularly around working with Welsh Government on the data promise and the establishment of the Information Asset Register, have moved from strategic mission 4 to strategic mission 1. So that's following discussion with the exec leads, Ivan and Rydian, just to ensure the alignment was felt to be better placed with strategic mission 1 being the link to the information governance standards and cyber. And finally, I just want to highlight that the strategic mission 5 exec ownership has changed. So it was Helen previously, that's now Claire as Deputy Chief Executive leading that. So Claire will, going forward, provide the updates on this strategic mission, including today. So I'm gonna hand over to each of the leads now, just to talk through their Q1 progress on the action plan and their RAG self-assessment outcome and the rationale for the assessment they've given in terms of where we're at. So if it's okay, Ivan, I'll ask if you start and cover both your strategic missions and then move on to Gareth, then Rydian, and then Claire. So over to you, Ivan.
Great. Diolch yn fawr iawn, Chris. So we'n mynd i wneud gair am iaith i gychwyn. So cyfieithu control gap. Control gap yw bwlch rheoli. Ac yn Gymraeg, mae'r gair rheoli yn meddwl control a mae fe meddwl management. A wy'n meddwl bod hwn yn ffordd eitha defnyddiol i edrych ar hwn. O'r sgwrs ni newydd gael ynglyn â'r adroddiad perfformiad, yr IMTP yw ein control mechanism a performance report yw rhan o'r assurance mechanism sydd gyda ni, a dyna i chi'n gweld fan hyn yn y baff, yn y fframwaith sicrwydd. A beth i ni hefyd yn ffocysu ar yw lle mae yna fwlch yn y sicrwydd, yn y rheolaeth sydd gyda chi, neu'r dulliau rheoli a'r sicrwydd sydd yn dod o hwnnw. Dyn ni ddim yn ceisio rhoi ar y slides pob peth i ni'n defnyddio ar gyfer sicrwydd. So, ar gyfer y strategic mission cyntaf, y platform ar gyfer trawsnewid digidol, dyma yw seilwaith yn systemau digidol ni, y data, yr is-adeiledd, y systemau technoleg wybodaeth, y canolfannau data, pob math o beth eraill sydd yn cynnal popeth arall i ni'n gwneud. I ni'n ffocysu ar hyn o bryd eleni yn disgrifio y bensaerniaeth agored sydd gyda ni, open architecture, open platform, a dilla ni o weithredu a esbonio hynna i'r byd tu hwnt, a wedyn hefyd gosod allan beth yw'r rheolau i bobl fedru defnyddio hwnnw yn arbennig ein partneriaid fel Bwrdd Iechyd, ond yn ogystal â hynny ein cyflenwyr a bobl eraill sydd eisiau arloesi. A'r mwyaf clir i ni'n diffinio hynna, a mwyaf fydden nhw'n gallu arloesi ar y platform hwnnw. Fel wedodd Chris, i ni'n ofalus yn y maes hyn, mae yna ddata mewn yna, mae yna agweddau seibr yna, mae yna wybodaeth bersonol yna, felly mae rhaid i ni fod yn briodol ofalus yn y ffordd i ni yn handlo risg. Ni wedi sgorio hwn yn oren, dwi'n mynd i gael gair amber yn Gymraeg, orange, red, orange, green. So oren yw'r sgôr fan hyn. A mae hynna oherwydd bod yna lot fawr o reolaeth i gael yn ei lle yn barod. Felly, dyn ni ddim yn adeiladu o ddim byd, dyn ni ddim yn creu dulliau rheoli newydd, mae yna dulliau rheoli i gael yn amlwg ar gyfer gwybodaeth, ar gyfer seibr, ar gyfer diogelwch yn systemau. Mae hynna i gyd yna, i ni'n ceisio gwneud rhagor. A ni wedi gwneud cynnydd yn ystod y chwarter cyntaf, felly i grynhoi ar y gwaith ynglyn â'r bensaerniaeth agored, ni wedi llunio yn gweithio gyda'r prif benseiri ar draws y sefydliad, ni wedi llunio 3 pecyn gwaith, a ni'n edrych nawr ar sut i roi grŵp lliwion i le bydd yn goruchwylio'r gwaith hynny, a wedyn sut ni'n mynd i gael adnoddau i ddilifro'r gwaith hynny. Wy'n creu bod rhaid i ni edrych, un o'r cwestiynau allweddol yw, oes gyda ni'r capacity i wneud y gwaith yna i gyd o fewn y sefydliad, neu os angen i ni brynu capacity mewn o'r tu allan, achos fel ni wedi bod yn trafod trwy'r bore, mae yna lot fawr o bwysau ar ein tîmoedd ar draws DHCW. A ni wedi colli ein prif bensaer Rob Jones yn ddiweddar, felly mae yna fwrch ar y lefel arweiniol yn y maes bensaerniaeth yna. Ond mae yna gynnydd i gael, mae yna becynau gwaith hefyd. Mi nath Chris sôn am symud rhai pethau o faes Rhydian ata i, y data promise, ni wedi bod yn gweithio'n agos gyda'r Llywodraeth ar hynny, a hefyd ar gyfer y cofrestru'r asedau gwybodaeth, a mae'r sefydliad wedi bod yn gwneud gwaith da hynny anfewnol. Felly, amber neu oren yw'r sgôr am yr un cyntaf. A wedyn ar gyfer y trydydd un, sef agor a cofnod, eto, mae yna lot o reol i ni wedi yn hanesyddol talu lot fawr y sylw i sut mae bobl yn defnyddio'r wybodaeth i ni'n gallu darparu. So, os gyda ni wasanaethau digidol, os ni'n agor lan y cofnod, y prif gofnod gofal iechyd ar draws Cymru, sut mae bobl yn defnyddio hynny yn y ffordd gorau. Ein blaenoriaeth ar gyfer y flwyddyn hon yw user design, neu cynllunio gyda defnyddwyr, cynllunio gwasanaethau digidol, a gweithio'n agos iawn gyda nhw. Beth i ni wedi gwneud hyd yma, mae'r bwrdd ei hun wedi cael sesiwn ar cynllunio defnyddwyr. Mae Gareth a finne wedi bod yn gwneud rhywbeth ar lefel executives hefyd, er mwyn gweld beth sydd allan yna, a ni hefyd wedi cael gorolwg cyflym o lle fydden ni yn gallu tynnu ar bethau sydd o fewn y sefydliad yn barod ar gyfer cynllunio defnyddwyr. Service desk yn un lle, i ni gael adborth oddi wrth yn defnyddwyr. Y tîm trawsnewid busnes, y business change team i ni'n datblygu ar hyn o bryd. Y gwaith mae'n tîmau datblygu yn gwneud ta beth, a hefyd y gwaith i ni'n gwneud ar lefel strategol gyda'n partneriad o ran, byddwch chi wedi gweld hwnna yn yr adroddiad diwetha, o ran y strategic engagement i ni'n gwneud, achos mae'n defnyddwyr ni ar draws y system i gyd. Mae yna le i wneud mwy, a byddwn ni'n gweithio'n agos iawn gyda CDPS ar hyn, o ran cael tîm penodol. I ni'n ddiweddar iawn wedi penodi pennaeth ymgysylltu, Head of Engagement newydd, dydy hi ddim yn cychwyn tan diwedd mis Medi, ond bydd yn rhan o'r sgôp yn y rôl hynny i ddatblygu tîm neu adnodd. A dyna pam mae rhai o'r mae'r amserlen tipyn bach yn hwyrach, felly ni'n mynd i gadarnhau beth yw y ffordd i ni'n mynd o gwmpas hwn yn Q2, a wedyn yn dechrau delifro yn Q3 a Q4, oherwydd y lag o ran dod o bobl ymlaen. O ganlyniad, mae hwn hefyd yn oren neu yn amber, achos mae gyda ni gynllun i ni wedi bod yn gwneud rhywfaint o gynnydd, ond i ni hefyd yn adeiladu ar lot sydd yna yn barod. So, falle os wy'n trosglwyddo i Gareth ar gyfer thema 2, a bod ni'n dod nôl o gwestiynau ar y diwedd eto ni gyd, a wedyn handlo hynna. Yeah, great. Okay, Gareth, over to you.
Diolch, Ifan. For BAF Mission 2, as Chris has said, this is a cautious risk on this, but we have made good progress during Q1. There are overlaps, as we mentioned before, between what I'm doing on mission 2 around user engagement, user feedback, and then what Ivan is doing around user design, which is why we're working so closely together, rather duplicating effort whenever we do any research. We've made some good progress, as I've suggested. One of the major aims for mission 2 is around the product approach, which ties in to our cloud implementation, our cloud strategy. Just to reiterate, what we're not doing is lifting and shifting out of the data centers just to get into cloud. It's a far more pragmatic approach of when we go to cloud, it will be part of a redesign or a re-architecture with our existing applications and services that sit within the data center, which is why the two link very closely together. We've discussed at very high level at board and at various management boards around product approach to ensure that we have a common understanding of what it is we're trying to achieve. We had another discussion at board development on that approach, and what unfortunately was missing at that time was some work that's now being carried out with the infrastructure and application teams as to what that means for DHCW. So which applications and services might we want to look at sooner rather than later, or as a priority to move into that product area. It says on here that there's been one directorate planning workshop on the 12th of July. There have been 2 subsequent ones since then, face-to-face, where we've had all of the operational teams and input from other delegates into exactly that. What does that mean? If we pick on a particular application, for example, what dependencies does that have? What workload does that generate? And it's quite a big piece when you look at all the links and the interdependencies. There are some good plans. There's a draft plan put together, which I'm excited to be able to share with you soon. But at the moment, we're still ragging this assessment as amber, not through any reason that we don't have significant controls about what we're doing, or there's not enough assurance about what we're doing around putting technology out there. It's still down to that there is no consistent user experience and user feedback at that level that we would want to have. So I think until that is more mature, I wouldn't be looking at dropping this down from an amber. But I'm pleased to say that the work we've done around cloud implementation, the product, even bringing cyber and the wide area network strategies, they all embed, they all lie on top of each other, which they're starting to do now, which will give us a far more direct and clear approach to how we're going to achieve this mission. Thank you. I'll pass on to Rydia now for number 4, please.
Thank you, Gareth. For those following in the pack, I'm talking and summarising slide 193. So the strategic mission 4, and I would say this, wouldn't I, is the most important one, because what we're here to do is to use data in a way that provides better outcomes for the individual, for the family, for the community, for the region, for the nation. And a couple of things that are required for us to put ourselves in the best position to do that. I'll highlight now. The work continues on developing the research and innovation strategy. We've provided an update already in May of this year to the DGNS committee. We've been having internal conversations with our staff, so 10 talks, for example, providing background to the emerging strategy, and that happened in July. And we are working with Welsh Government colleagues regarding the data promise, which is a key component of how we land the conversation about how data is used to deliver value. The RAG score assessment is amber. Digital Healthcare Wales has the controls of the research and innovation strategy, and we have obviously work to do to influence the data promise. I anticipate that further progress will be coming to the DGNS committee regarding the research and innovation strategy next month. So that would be my summary of the mission 4 as described in the pack for you. Thank you.
And you're handing over to Claire, is that right?
Yeah.
Yeah. So this obviously mission 5 is the most important one, obviously, that goes without saying. This one is the one that really knits the organisation together. This is about being a trusted partner. It's about talking about high performance, ambition, inclusivity, workforce, stakeholders, and quality, which is really important. During the quarter, we've highlighted quite a number of risks, and actually we've discussed a lot of those risks today. We're talking about staff vacancies, the data centre, re-procurement, for example, inflation and sustainable funding, the importance of the Welsh language compliance, and really important quality, ensuring that we are a quality organisation. So we have made quite a number of progress during the quarter on the mitigating actions against some of those risks. So from a people perspective, the people and OD strategy has been drafted and discussed at the directors' strategy session in June. We've talked a lot today about the commercial workforce resourcing task group that Sarah Jane is leading together with Michelle. The Welsh language scheme is out for public consultation from the 1st of July to 30th of September. And we've done some great work in really increasing the profile of Welsh speaking across the organisation with the work that's undergoing now. The long-term financial strategy, we talked quite a lot about this today, and there are pieces of work that we have been doing in Q1. That would be about the inflation calculation that David challenged me about earlier, which we're trying to land that concept of digital inflation. We've done a detailed costing exercise that we're validating at the moment, and that will really inform the gap, if there is one, between our SLA funding and the cost of providing those particular services or products. The other bit, we've really tried to understand what a sustainable funding requirement would be. What is the impact of the digital priority funds as they become and translate into business as usual? So those pieces of work really inform the requirements, but equally then we can then consider about how we do that alongside our colleagues in Welsh Government. So we've done quite a bit of work there in really understanding where we are and where we're going to inform that. We've formulated the comms TNF task and finish report, which will be finalised for discussion. And also we're looking together, working with our partners, is to understand the national digital maturity, understanding where we are as individuals, but also as a collective, and to inform our direction of travel and vision as we go forward. So we are doing a lot of mitigating actions. It remains amber, that's the profile we've given it, and it's got a moderate risk appetite. I think that really reflects where we are. I think we've got some work to do to take it to green, if I'm honest. We've got some hills to climb before we get there. And equally, there is an argument to say, as the outcomes of those activities become clearer, we might have to consider whether it's amber or whether it's red. So for me, there is quite a lot of work to do in that space. We are doing a lot of work, and obviously I will update you as that work progresses and as we see the outcomes of some of that activity. Thank you, Chair.
Thank you, Claire. Is there anything you wanted to come back on, Chris, before I open it up for discussion?
Open it up, Simon.
Okay. Anyone got any questions or comments on what was quite a comprehensive run through of the BAF? Helen.
Yeah, just quickly, thank you, Simon, and thanks to the team really for presenting the overview on each element. We went through this on our joint executive team meeting with Welsh Government colleagues yesterday, and I think what it demonstrates for us is the join up that we're trying to achieve as a board and as an organisation, actually. So we see that, the golden thread of all of our missions and our strategic objectives and the risk management and the processes that we're putting in place. So I just want to say I'm finding this a really useful tool, actually, and I think it's still a lot of work to get to this point, and I just want to commend the team for all that they've put into it. But I think it is really a useful tool for us to have that oversight of where we're heading, and particularly the RAG rating and the honesty, actually, that reflections that the team have put across really in terms of some of the challenges we've got and the amount of work we've got to do. But I think it's a really good way of us being able to keep an oversight on this as a board. So thank you to the team.
Thank you, Helen. Rowan.
So Helen, I agree, and I think what's yeah, the exec team is to be commended, because what this says is the corporate risk register isn't a dusty document that lives on a shelf, right? It's a living document, and this places it, you know, in you know, how we run the business and measure it. So I think that is a really big step forward in the maturity of the organization. So well done. The second thing that I just would flag is that you know, we can only control what we can control. That kind of sounds obvious, but you know, particularly in some of the areas of, you know, how we implement some of our implementations, you know, they run across organizations. So we are reliant on other parties' risk management and maturity, and you know, that's a mixed picture. So, you know, there are things on this board where our risk appetite is cautious, which might not be matched by other organizations because of their maturity or situation, or, well, I can't really comment. So I think that is important for the board to realize. And then I think the third piece for me is that this is a living document existing in a world that's moving quite quickly. So we talk about data promise. There was a really excellent seminar that I attended, partly by accident yesterday, by the Bennett Institute in Oxford, which was doing a sort of fast trot through the Goldacre Review, Data Saves Lives, and the digital security legislation that's going through Westminster. And for us as a sort of devolved organisation, we sort of have a sliding angle through that. And some of the Westminster legislation will have national impact across Wales. Some of it is a bit more of a smorgasbord that some of it will affect us, some of us it won't. And I just, you know, just to say things, you know, digital promise is obviously being walked through the Welsh Assembly, but is also being impacted by this sort of wider ecosystem. So I don't know how we capture that, but it's core to our business. So just share that, really.
Yeah, absolutely. Thank you. We've been asked to approve that report. Are people happy to do that? Thank you. And then we're still with you, Chris, to introduce the corporate risk register report.
Yeah, thank you, Simon. So just going to pick up where we left off. So the board assurance report, the conclusion of the work to develop that as a report that comes to board on a regular basis now was the last milestone of the risk and BAF milestone strategy that we established when we commenced last year. But recognizing, as Rowan's just eloquently pointed out, risk isn't a static activity. So within the pack, there is item 6.4 II, which is the forward work plan, which just sets out when there are opportunities for committee deep dives into some of the corporate risks, and when and how we'll be reviewing our risk appetite on an ongoing basis. The second thing I just wanted to draw to board members' attention, as I've done previously, just to note the prevalence and prominence of digital risks in the global environment, so in particular cyber risks, as highlighted in the World Economic Forum Long-Term Global Risks Landscape 2022, very much a prominent feature there, and indeed for us here at DHCW. So just going to talk through the risk, corporate risk profile that we have at the moment. We currently have 25 risks on the corporate risk register, 15 of which are detailed within the risk register included in the pack. There are 10 private risks, 9 of which will be considered, as Ridian alluded to, at the Digital Governance and Safety meeting, which takes place next week. And those predominantly relate to cyber-related risks that committee has an assurance function to oversee. And there's one new risk that's been added, which will be considered at the Audit and Assurance Committee, which isn't included for commercial sensitivity reasons. So I just want to draw board members' attention to the new risks that have come on since the last public board meeting, and there are three. So there's one 0291, which is network equipment delays in relation to the data center 2 move. 0292, which is insufficient human resource capacity in the infrastructure teams to undertake business as usual activity and activities in our first year plan. And then finally, the third new risk, 0293, which Claire mentioned earlier, and we had the discussion, which is around the DPIF funding letters. And I think this one in particular, just to highlight, this is another financial pressures related risk that has been added recently, and just note that over the last 4 months, we have had significant number of risks relating to financial pressures, and I think reflects the conversation we've had today. So I'm just going to invite Gareth to come in on the 2 new risks that he's approved from his area, and then whether Claire wants to add anything on the DPIF funding letters, or whether that is covered. Claire, I'll leave that to you. So I'll start with Gareth.
Yeah, Chris. So supply demand since COVID has been problematic to say the least. We have a significant investment in our network equipment in order to achieve a timely exit from our existing data center. We are working very closely with suppliers to ensure that we can achieve all delivery this financial year. There has been some mitigation by me. I've asked for, where possible, that the order is split over multiple purchase orders so that we can mitigate some of that loss if the equipment arrives next year. We're working with suppliers on a weekly basis. Times for delivery, they change weekly. There is a small amount of risk that already some elements of the order are looking like they might go into next financial year, but I would strongly expect that to change next month. We've also looked at alternative arrangements on some of the design and hardware. Can we try something different? Could we install something different that would achieve the same thing? And looking around that, and we've done that piece of work. So we are where we are in that we are at the sort of request of the suppliers to deliver on time. But the risk is real that if our kit doesn't turn up on time, it has a knock-on effect to being able to exit data centers in a timely manner. Hence, it's a corporate risk. The second one, we have touched on this throughout this meeting around resource capacity. I won't dwell on this point. We are, if we don't recruit and we can't get a sustainable recruiting model in place, we will struggle to deliver on some of those IMTP targets because they are resource dependent. And we've talked about how we're working very closely with workforce and continue to do so, looking at various options with strategic suppliers and other routes to market that we can get resource in. So we've raised both of those as significant risk on the corporate register. Thank you, Chris.
Thanks,
Thank
Gareth.
you, Gareth. Claire, did Chris ask whether you wanted to add anything on the DPIF, particularly DPIF letters?
Yeah, I think we've covered that. But I've reread that risk again, Gareth, the 292, and when you looked at the bridge that we looked at earlier in the financial review, it highlights that within ICT, actually there is a overspend actually reflecting the additional resource we've got in ICT in relation to support. So when you say insufficient resource, I assume there you're talking about the ADS aspect that is resource constraints, not necessarily the ICT.
Yeah, my apologies. I generalized as operations. That should have been more specific in that's application engineering is where this risk is at. Yeah, sorry.
So, and those are related to vacancies, and therefore it's the funding is there. It's just the vacancies is the issue.
The recruitment piece, yeah.
Yeah. Okay. Yeah, that's clear. That's clearer. Thank you. Yeah, I think I'm happy to take any further discussions on DPIF, but I think we've covered that.
Okay, thank you, Claire. Chris, do you want to come back on anything?
Yeah, I'll just quickly highlight the remove risks around the second DPIF risk, which colleagues will recall when we first had the reprofiled DPIF position came on as a risk. That's been downgraded following the work through Claire and the Digital Directors Group to agree prioritisation and reprofiling, so that's included. Just a couple of other points. The heat map in the report highlights Canis continues to be our highest risk. And as mentioned, I would just make board members aware of that shift, very stark shift. When you look at our risk profile position now compared to this time last year around the financial pressures that we face as an organisation, and Marion, as Audit and Assurance Committee Chair, has asked for a deep dive in this area at the next Audit Committee if this position remains as it is at the moment. So we've got that planned and scheduled in. And then finally, just to conclude, the as mentioned, the private risks, the cyber risk, which is, I guess, the other area where we have significant number of risks, will be reviewed and scrutinised next week at Digital Governance and Safety. So I'll conclude there, Simon. Happy to take questions.
Okay. Any questions or comments on the risk register? I mean, I've just got one, which I've had an early conversation with Helen, and had a brief exchange with Andrew, and we'll have a conversation with Andrew as well, I think, and probably September the situation will be clearer, but I think there is a potential risk in the autumn and the late autumn around well, everything that's going on in terms of pay and the implications for what staff might decide collectively to do. But I think probably September we'll have a clearer view on where that is, won't we, Andrew, in terms of the feeling amongst and this isn't just us, obviously, it's the wider NHS and indeed the wider public services, but I suspect it will appear on our risk register in the not too distant future. Okay, thank you very much, Chris. If we move on then to, oh, sorry, we're asked to receive that report, isn't it, Chris? If we move then on to a series of reports from the chairs of committees, and the first is the Audit and Assurance Committee. So if I could ask Marion if there's anything she'd particularly like to draw to our attention resulting from the meeting on the 4th of July. Marion. You're on mute, I'm afraid. And mute's the same in Welsh as it is in English.
Isn't quite, but thank you for that prompt. Mae'n bleser gen I gyflwyno adroddiad y Pwyllgor Archwilio, ag dwi am dynnu'ch sylw chi at un neu ddau o uchafbwyntiau, a mae nifer o'r pethau sydd yn ymddangos yn yr adroddiad mae wedi cael eu trafod wrth gwrs yn helaeth yn ystod y cyfarfod yma, y bore yma. Ond unwaith eto, mae'n dda gallu adrodd fod na gynnydd cyffredinol boddhaol iawn wedi digwydd mewn gymaint o feysydd sydd wedi bod o'n blaen ni fel pwyllgor. Ag fel canlyniad, ddaru ni gymeradwyo cael lawr 920 o gamau gweithredu oedd bellach wedi eu cyflawni. Ddaru ni hefyd gymeradwyo'r adroddiad blynyddol, fel y gwelwch chi, ar y gwasanaeth atal twyll lleol a'r cynllun blynyddol atal twyll ar gyfer y flwyddyn ariannol hon. O ran, ni wedi clywed ac wedi trafod yn helaeth yr heriau sy'n wynebu ni fel sefydliad o ran y gweithlu, ond o ran yr archwilwyr mewnol, mi gaethon ni adolygiad ar y gweithlu, a mae'n dda gallu adrodd yn ôl yn bod ni wedi derbyn graddfa sicrwydd rhesymol, ac yr un dyfarniad, graddfa sicrwydd rhesymol, eto gan yr archwilwyr mewnol ar adolygiad y gyfarwyddiaeth. Mi oedd na hefyd ddiweddariad gan archwilwyr Cymru, ac roedd yn dda gyda ni nodi fod na gynnydd yn cael ei wneud ar yr asesiad strwythurol, a fydd yn dod yn ôl i'r pwyllgor pan fydd wedi cael ei gwblhau yn ddiweddarach yn yr Hydref. Fel y gwelwch chi hefyd, ddaru ni derbyn yr adroddiad safonau ymddygiad a'r adolygiad blynyddol ar ansawdd a'r rheoleiddio. Fe nodwyd gyda balchder fframwaith gwelliant cydymffurfiaeth y Gymraeg, roeddwn ni falch iawn o weld hwnnw, A dwi yn teimlo yn bod ni fel pwyllgor yn eiddfedu wrth i'r misoedd fynd rhagddo, ond dyn ni ddim yn hunanfodlon ac o'n i jyst eisiau rhannu efo'r bwrdd yn bod ni'n bwriadu mynd i ar sylwi pwyllgor archwilio un o wasanaethau cyhoeddus eraill Cymru, jyst i weld oes na arfer da y gallen ni fabwysiadu wrth symud ymlaen. Felly heb ragor o fanylion, diolch i chi am wrando.
Thank you, Marion. Is there any, I'll be fascinated to know which one you pick. And Claire?
It was really a reflection of the work of the Audit Committee that was raised in the JET meeting actually yesterday, where we were complimented on the carbon plan that we'd done, the Welsh language plan that we'd done, and all of those have been overseen and scrutinised by the Audit Committee. So I think it reflects the diversity of the agenda, but also the additional process that the committee brings to really evaluate, present, and show that work that really informs then our IMTP. So yeah, it was lovely to hear from the JET group. Thank you.
Thank you, Claire, and thank you, Marion. So we note your report of that committee. If we move then on to the Local Partnership Forum highlight report, and as people be aware, there's co-chairs of this forum, and in this instance, Andrew was in the chair and is going to present the report. Andrew, it took on meeting on the 7th of June, I think it was, Andrew, isn't it?
Thank you, Chair. So this was Sarah Jane's first meeting with us, and I'm very welcome she was. We also had a member from Audit Wales in attendance because we're audited on that committee, so which we welcome, of course, because it just demonstrates we're doing everything properly. So as with all the other committees, many of today's board agenda items were on our committee. Those with specific relevance to staff mainly. So, for example, the risk management report was on the committee, and of course, all risks related to staff vacancies are of particular interest to us, really, because obviously there's a wider impact. I mean, again, workforce activity is also something that's of particular interest to us, and we look positively on the green rates, as it were, of the appraisals. Obviously, we look at them with great interest. Sickness absence, which is at a very good level at the moment. Obviously, we're very interested in that, and of course, we're very interested in the statutory and mandatory training of staff to make sure that staff are appropriately meet their obligations, but also are appropriately trained in those areas on a regular basis. Something that was quite a new concept to us during the COVID-19 pandemic, of course, was a lot of us were working from home, and we've obviously moved forward with a new way of working, particularly hybrid working. And at the last meeting, we looked at the draft. There's a draft policy which is being or has been developed around the hybrid approach, which is very important. Just thought I'd bring that to the board's attention. You will see that in a bit more detail, I think, in a future meeting. We looked at the staff conference, and which I think was a very positive event, and also staff awards that were given at the conference. And we're now looking forward to next year's event. There's a health and well-being, or was it this year's event? I'm trying to think when we had our last staff conference. Things merged, don't they? The days merged.
I think it must be next year.
It is next year, isn't it? That's right, yeah. The health and well-being group, of course, has got a direct link into staff well-being, and we look very positively on that. It's not actually me on that group, it's another rep a couple of reps that are involved in that, but that obviously comes to local partnership forum. It's very, very positive. We had some discussions on the cost of living crisis, as we've discussed earlier. We're watching this with interest, and we're keen, really, as trade unions. We've got support mechanisms, but also as an organisation, we're keen to support staff in any way we can. That's it, within our power, of course. And that leads us into the pay review body, which at the time in the local partnership forum hadn't reported, and we were looking with interest at that meeting to see where, to see what the recommendations would be. I mean, just further to that report, I know that the trade unions will be discussing over the coming days the approach that they will take. So that's item for discussion at the next local partnership forum potentially. But I just wanted to say a big thank you to the corporate team as well for all their support and making the meetings a success, and to making sure that the chair is as organised as possible at the meeting, which I am very grateful for. Otherwise, I just just like to present that report to members.
Yep.
And if there's any comments, I'd be glad to.
Thank you, Andrew. I'd certainly echo that last sentiment of yours, definitely. Any questions or comments? Ruth?
Dale, Simon, Dale, Andrew, for that update. It's always really interesting to hear from that staff perspective. On the well-being point, you know, everybody's really happy, but which is great, but do you see and do you discuss at the partnership forum any particular areas where there might be concerns or hotspots? Are you seeing that it's a consistent happy picture, or are there any areas that we should be giving a bit more focus to?
I mean, obviously the local partnership forum is a place where we would look at those kinds of things. So health and well-being, I mean, is quite a proactive group, and we've got a rep on it. If there were any problem points, I think we'd certainly take those forward to address. But we also see the positive points in the local partnership forum as well. So, yeah, I mean, I think we anticipate issues with the cost of living, even though nothing seems to be filtering through yet. But we're ready for it, because I know towards the end of the year, energy is going to go up again.
Okay, thank you very much for that, Andrew. Sarah Jane.
Yeah.
Thank you. Just to add to that, we also have weekly meetings with Andrew and/or a designated trade union representative. So at those meetings, we would probably do some of that more hotspot analysis in that sort of more private fora. And that actually works really well informally. So we would look at, you know, areas of potential high turnover, or perhaps somebody's sort of raised something, and rather do that sort of in the wider group. We might report on that in the round as a more sort of an exercise that's taken place. It's been successful. But I guess if things are happening in actual time, we try to do that in that sort of group and look at that and identify and think, well, is there something we need to have a look at there, or do we need to get involved there? And really working very closely in partnership with the trade union representatives, because, you know, we all want the same thing, really. We all want everyone to have, you know, be really well motivated, have good health and well-being, and so forth. So we're all sharing that agenda, but we're getting the information from different ways, through our data analysis, through the feedback, through surveys, and through the trade union representatives. So it's a really good working piece, actually. The relationships are very much in good and productive order.
Thank you for that, Sarah Jane.
Thank you.
Nothing else then. If I could ask people to note that report from Andrew there, thank you. And then moving on then to the report of a meeting on the 20th of July of the IM Digital Network, which David chairs. David, over to you.
Thanks, Simon. Yes, the meeting took place last week. It was well attended from across NHS in Wales. Pleased to report that Aneurysm Bevan have now appointed a digital IM, and he was able to join us for the first meeting, which was really great. The first substantive session we had was from Hamish Lang and Rian Hamer on the digital medicine portfolio that Helen touched on in her report. The briefing went down really well, and we had a really good session after that. Probably about 30 minutes spent on questions from the floor in terms of particularly rollout in the health boards, the pace around that. One of the key points that arose during the meeting was that health boards will have some choice, but not all of the platforms that are available are open in architecture, and there was some discussion about the benefits of an open platform in terms of the wider strategic objectives. The second item we covered was a briefing from Claire on the new Microsoft contract. That again was well received by members of the network. Some really positive feedback in terms of the DHCW role in negotiating on behalf of NHS Wales and getting what was widely regarded as a very good settlement in terms of the deal that Claire and the team have managed to agree with Microsoft. Lots of positive feedback around the strength of the NHS operating collectively when negotiating, which was good to see from our colleagues in the health board. The third substantive item we had was a briefing on electronic test requesting, which was led by Ridian with support from Sally Pritchard. Again, that was well received. The main thing that came out of that was there were some charts in there which sort of showed the level of take up across all of the health boards. Not all of them were at the same level. So there was some really good discussion after the briefing around the reasons for the varying deployment, and the IMs for the health boards went away with some good insight into what problems there may be locally in terms of adoption, and therefore what they may be able to do to help us. And then the last item we had was a briefing on the workings of the All Wales Director of Digital Peer Group from Stuart Morris. Again, he covered the sort of main things that they've been focused on over the past few months. Some really good synergy in terms of the things that they were worried about and things that the IM network are worried about. And the conclusion that that group and the group that I'm currently chairing probably should have some more touch points as we go forward. The last thing we did was had a little bit of a reflection. This was the third meeting that we'd had. I just wanted to get some feedback from the network on how it was running, with some pointers to things that we may be able to do differently going forward. And the meeting ran pretty much the time, which was a 3-hour slot.
Thank you, David. Any comments or questions for David on the network, which seems to be operating really well? And as we move into the autumn, David, we'll need to think about, as you know, there's the chair's schedule, I mean, for want of a better word, scheduled in a review after a year. So I think we'll need to have a conversation about how we do that. But from certainly what I hear and you tell us is it's going really well. So thank you very much for that report, and people happy to note that report. And then finally, from me, the meeting of the Remuneration and Terms of Service Committee, which was held on the 21st of July, and 3 things really just to bring to your attention here. I'm pleased to say that the committee ratified a recommendation that Andrew Fletcher, who's current associate member for trade union, his tenure be extended to run until the 31st of July 2025. And we're really pleased to have you on board for a further 3 years, Andrew. And the committee were very happy to ratify that recommendation. Second, we received an update on the Director of Primary Community and Mental Health Digital Services role, which is close to its conclusion. In that, I think we have the interviews next week, isn't it, Helen? So that and then it'll be down to finding an excellent candidate, and then how long they have to give notice for in their current employment. And then finally, we did 2 other things. The Executive Director of Operations, the substantive post there, went out to advert at the beginning of this week. So that will be that will complete our suite of executive directors, which will be excellent. And then we had a session looking and reviewing the executive team's objectives which are all now been signed off and completed. Happy to take any questions or comments on any of that. No, thank you. Happy to note that report. Okay, I have any other items of urgent business. I haven't had any brought to our attention. Now, just before I finish, I mean, before I close the meeting, there's, as you can imagine, there's a small army of people who help bring these meetings together, both the teams who produce the reports and support the executive director and the directors around the table. And then there's a little small army outside my door there from the comms team, and they're the people who make sure the slides go up on time and everything runs smoothly. And there's one who has a very important job, which waves frantically at me when I forgot to turn mute off. That's Tazy Drake, and I just like to and Tazy keeps myself and Helen honest in terms of our Twitter content as well on behalf of DHCW, and it's Tazy's last day today, so I think it's appropriate to thank her as member of the comms team for all the work she does. These meetings go smoothly, so thank you, Tazy, and I hope everything goes really well with your new job in Aneurin Bevan. And on that note, the date of the next meeting is the 29th of September. But before that, we have the very important meeting this afternoon starting at 4 o'clock, which is the annual general meeting, our first annual general meeting. I know everyone I can see on the screen is going to be there. I hope those people who I can't see on the screen and have joined us for the meeting today can also be with us later this afternoon. So thank you all very much for your attendance today, your involvement today, and I'll see you all later at 4 o'clock.